peer-to-peer education. So what I want to do is open the floor quickly. And I would like to hear from some who are on this morning that were here yesterday. So please, if you will, raise your hand or unmic, and I'd love to hear input from some of you out there on what you took away. What was your takeaway from yesterday's session? And you can choose any session to speak on. We can start on session 1 for anybody who was here yesterday morning, or I guess yesterday afternoon. Comments. I know I see some familiar names that were here yesterday.
I can speak, Alice, if you want.
Sure.
The ball rolling. And excuse me, I am actually post-COVID, so this residual is still there. Yep, that's been fun. But no, I in fact, to the two panelists I'm going to have on today, I think I was just sharing with y'all when we jumped on, and not everybody was on yet, that they were unable to make that beginning session. And I said, y'all really need to go back and listen to that recording, if not, the whole day. But I just think there was such concrete, great ideas with involving the shack and truly connecting that for that whole child. It really delved into what the district can do, what the parents can do. And I really just appreciated such robust, concrete ideas that the districts were doing. So I think that one was excellent. And the mental health one, again, it's such a huge issue right now. I think they gave some great ideas as well. So just a wonderful way to start off the summit. Unfortunately, I had a conflict and I couldn't be on for the last sessions, but I know those were great too.
Perfect. Thank you. Good points. Yes. We started the day yesterday talking about the WISC model and just kind of the whole child, whole school, whole community, how everyone works together and should be working together. And so it was good to hear some very, as Karen put it, concrete examples of how that partnership is working at the local level, at the district level, but how change is happening, or how they're being very successful in those endeavors. Okay, somebody else. Anybody want to comment on some of the afternoon sessions, either with the physical activity, that was the session that Pete Silvas moderated, or with the youth panel?
Good morning. I'll jump in. I'm from Keller ISD up in North Texas, and I really enjoyed the whole day yesterday, but talking about the afternoon, in my notes, I just really appreciated the link between physical activity and narrowing that learning loss gap and how important that is. And we've got a couple of nurses in our district who partner with the PE teachers to do running clubs and that sort of thing. So I was happy to hear about that in other school districts as well. And then I just really appreciated the student feedback. I thought that was neat, and that gave me an idea for our shack to bring in maybe our 4 high school student council groups and just talk with them, with the shack leadership, to find out what's important to the students, because that's ultimately who we're here to serve. And also ask them what are the best ways to get that information out to their peers and what they think would be best. So thank you for having this. It's very informative.
Thank you so much for your input. I would agree. I think, Michelle, if you want to go to the next slide. These were, as I was stepping back and also in concert with Michelle and a couple of other steering members, as we looked at the day yesterday, I think that there were a couple of things that stuck out. Trying to look at how do we navigate what has been termed the learning loss, and maybe start to look at things a little differently, and one of our speakers during the first session talked about, you know, do we start to transition to calling it, instead of thinking of being a loss, was it just interrupted learning that might have transpired, and do we continue to see, I mean, obviously, sorry to hear Karen and her family has been battling COVID, but it's still something that is around, and as people have illnesses or the flu or any number of other where someone may be out of school for an extended period, there's going to be that interrupted learning. So one of the speakers also talked about, that idea of keeping in mind what is the right decision for our students. And as Trisha just noted, that's what we're all about. And that's what schools and parents and community working together, it really is about the students' health and the students' success. And so how do we position all of us as partners working together to maximize and ultimately, help our students achieve and be the very best that they can be? How are we helping hold them up at the whatever level they're currently in? And I thought it was neat on the mental health session. Tracy talked about I think it was her that mentioned about these two questions, and I had to chuckle because the two questions, the what went well and what didn't go well, that is something that I have utilized with my children, both of my sons, from the time that they could talk and were going to daycare. I can vividly remember, getting them in their car seats, and as we were driving home, I would ask them, what was your favorite part of the day? What did you really like? And then talk about, well, what wasn't so good today, or did something make you sad, or and we would have these conversations the whole way home, and talk about, it was like a valuable car time together, to experience and really hone in on what they, and again, they were 3 years old, 4 years old at the time, but it's still something that we continue till today, because I think it's really important to check in. And another really great part was that they during the mental health session, they talked about, yes, it's really important to ask our kids, but we also want to ask ourselves. We need to pause and be okay with taking a pause sometimes in our busy lives, and encouraging teachers and school support and staff to take that same pause when needed, and be able to take a breath and know that it's okay when it comes to all of our mental health. And then as the afternoon progressed, as somebody mentioned a few minutes ago about the physical education component, really being intentional with our messaging to reach our students and our parents. It was fantastic to hear about all of the parental support, the dads that were actively engaged in before school and after school activities, supporting walking clubs or running clubs, etc. So being very intentional with our messaging and helping ensure that every group who is partnering, whether it's parents, whether it's staff and teachers, whether it's community members, that we're all very much working in the same direction and having those very intentional messages clear for us. And so that was great. And then lastly, there was a great amount of emphasis throughout the entire day on the value that school health advisory councils can have in your schools and in your communities, because they are such a powerful voice for the local culture, the local community. And so it was wonderful to see that shacks, and I completely understand that shacks are at different levels across the state. And so it was great to hear, though, that some are really making great strides when it comes to connecting those pieces, going back to the theme of our conference. Some shacks are really kind of, it sounds like to me anyways, they're kind of serving as almost the glue. If you think about the puzzle, they're kind of helping put all those pieces together and really build them up strong. And then lastly, yesterday, if you missed the student portion, I really encourage you to go back and watch that, just to echo some of the comments that others have made. It was fantastic. These students, the 4 students who joined us, are absolutely amazing change agents and change leaders. You could see how they were very dedicated. They were strong leaders in their schools and in their communities, and it was great to hear their insight. And so like I said, if you missed yesterday, please think about going back and watching the session from yesterday. And without further ado here, I am going to now pleased to introduce our moderator for this family connection section, another amazing steering committee member who we've had pleasure to work with on many occasions, Ms. Karen Burnell from Texas PTA. And I'm going to turn things over to Karen and let her introduce the panelists and tell us a little bit about what she has going on with Texas PTA. So Karen?
Yes, thank you, Alice. Thank you for that recap too. Well, good morning, everyone. My name is Karen Burnell, and the main role I'm serving today, the hat that I'm wearing, is the Texas PTA Healthy Lifestyle Liaison. And so just to give you a quick snippet, I actually came into that role when I had a 2-year-old and was pregnant, and I really didn't know a whole lot about PTA. But my background has been in health and wellness curriculum. I've been a PE teacher. I've been a research coordinator for UT School of Public Health, as well as a district coordinator in Dallas ISD in their health and PE department. And I was stepping away from that to just take a little pause, and was approached at a conference from somebody with Texas PTA and asked if I would be interested in doing this. And he starts talking about local PTAs and council PTAs and this and that. And it was just a whole new world to me. But it's become a passion of mine. I've been very passionate about school health and wellness for so long, over 20 years, but reaching that parent is really evolved into my passion now, because I think even when I was a district coordinator, that we thought we were doing a good job. You're sending home newsletters, you're doing outreach programs, you're doing family fun events and such. But now in that parent's shoes, I truly see, there's still a disconnect. How can we help bridge that gap? We're constantly trying to educate parents. Through our PTA avenues, we have an annual conference. We also host a series of webinars and newsletters. So, just trying to utilize that PTA voice to help them understand the great things that schools are doing, the policies that are in place to help the schools, laws that they have to follow, and so forth. So I'm excited today to share, and we have 2 wonderful panelists to talk about the great things that PTA can do. And if you don't have a PTA, just utilizing your PTO, any sort of parent involvement on the campus can be so instrumental in helping to support, like I said, the great things that the schools are doing. And just a little history too, and I'm going to give a short PowerPoint in a minute, but National PTA was founded on the 3 pillars of education, safety, and health of all children. Those were the 3 main reasons it was created. So not fundraising, not bake sales and things like that, although we do rely on our PTAs to provide that assistance to schools. They were truly founded for education, health, and safety of kids. So keep in mind that we've National PTAs had a big focus on health for a while. Texas PTA is continuing to grow their resources as well. So we hope that we can provide you with some resources and ideas today of how to help better connect the dots with the parents and parent education. So that's enough about me. I want to turn it over to my two panelists to give a quick introduction on themselves. I've known Melinda for quite a few years. I actually remember reaching out to her when the annual conference for PTA went virtual the year of COVID, and got connected with her and some of the great things they're doing in Northeast ISD. And Sarah, I'm also getting to know. She is with me in Richardson ISD and is going to be serving as the new parent co-chair on the SHAC that I now chair. And they both have a wealth of experience and background in health and wellness, and also being involved. So I'm going to stop talking about them and let them brag a little bit about themselves as well. So Sarah, I can see you first. I'm going to go ahead and let you share.
Good morning. Thank you. So I have a background. My bachelor's is in social work and my master's is also in social work. And for my master's, I chose to focus on adolescent reproductive health with an emphasis on research. I am very passionate about evidence-based programming and collecting data and making sure that the work that we do is impactful and we can show how impactful we are. So I worked for United Way on the health grants side for a while. I helped those who received funding from United Way make sure that they were monitoring their activities. And then I also have a previous work history with Texas Health and Human Services. After I had my twins, I stepped back from work for a while and got involved in their education. I am currently serving as the president of the PTA at their elementary school here in Richardson. And after I had the opportunity to join SHAC, I have also been able to make health and wellness more of a priority for our school. We have one of the smallest elementary schools in the district. So our parent power is really, it has to be impactful for us to be able to do something. We have to leverage that well. And so I am really trying to find ways to partner with our parents and our PE teacher and our counselor and our nurse to make sure that we are doing the best we can with the limited amount of resources we have in parent hours, because we have really passionate parents at our school, but it's just hard to not have volunteer fatigue. So I'm really excited to be able to work with SHAC and look at how, as a district, we can move forward in making our children healthy and keep that as a priority as we're, trying to make our SHAC as strong as possible.
Thank you, Sarah. You're so, love everything you do. And Melinda, let's go ahead and share a little about yourself.
Sure. Good morning, everybody. Thank you very much for having me. I'm sorry I sound a bit hoarse. I've got some major allergies going right now, but I'm
right there with you, girl. So we'll talk through this.
All right, great. So I'm very happy to be here. I have a background in communications. I have a master's in communications, and it seems like forever ago. With Northeast Independent School District, I know my last kid graduated in May, so I actually don't have any kids there, but I'm still fairly connected. I was on SHAC for 7 years. And we have a pretty good active SHAC. So I really enjoyed my time there. And I've been active PTA since forever. I can't even remember how many years, but as Karen said, we work together. I've been the Healthy Lifestyle Chair, both on the local campus level and also for council. I'm currently advocacy chair for a Northeast Council of PTA. So that's keeping me pretty busy at the moment. But I also started the Smart Driving Club at my high school, 2012. So that was what I saw as a safety and health need. My daughter was learning how to drive, and I was very concerned about that. So I basically just worked with the district and established that program, which we've done ever since 2012. So that's a very specific way where we work, in terms of safety with the students and the parents. And that's been my main avenue, is that parents get a lot of information. They have a lot to do. So I've always come from the other side, where I work to turn the student into the advocate, and then they share whatever sort of advocacy moment or health or wellness or safety issue with their parents. For instance, my high school students go out to the elementary schools, and we task those students with being backseat driving advocates. So I kind of work with the parent side, but then come around a different angle and focus on the students. whether it's advocacy for safe driving or health and wellness on the campus or anything like that. And then we kind of parlay that out to our community and also to our district. So our district's been really supportive. We've managed to get that program on other campuses and involve them in different ways. But then we also work with a lot of community members at the local and state level to try to share that information and figure out different avenues and different places and different means and to put that safe driving message. So that's what I do a lot. I've enjoyed my time on SHAC. I think SHAC is a tremendous group of people. And what I really like is that it gets you to see the district kind of from the inside out, and you get the chance to meet with people that you wouldn't normally sit in a room with. But it's also a really important chance for you to share your experiences from your campuses, because every campus is different, and every campus has different needs. So I think SHAC is a tremendous place to just kind of have a direct impact, and whatever SHAC recommends goes to the school board. So you also get that level too of interaction. And to me, it's just a really good way to kind of get a full picture of what goes on in your district and at the local levels.
Thank you, Melinda. I love everything you do too. And I'm just excited because, both of y'all come, you got, the elementary past experience, Melinda, but most recently, the secondary, and involved also very much at the council level. Sarah and I kind of bring a little bit more of that elementary perspective. And we need it all, right? And I think, we can identify gaps in both. I hear a lot of times, oh, we don't have enough resources for secondary. And then on the flip side, it's sometimes, well, there's not enough for elementary. So I really think that, we just continue to keep, utilizing experiences like this to help grow those resources. Okay, I am going to share my screen real quick and do a very quick PowerPoint just to kind of give y'all some of the resources that PTA has been developing. So, all right. Are we seeing my PowerPoint? Yes. Okay. So just a quick snapshot of the history. I mentioned National PTA has, been a focus on health and wellness for quite some time. So you can just see a quick snapshot of the myriad of health projects from, hygiene to mental health. It continues to stay a focus, and also in their legislative priorities as well as Texas's legislative priorities always have a focus on health and wellness too. Many of you were, if you were on yesterday, this WISC model, but again, this is set forth to identify all the areas that are intentionally supposed to be working together. It's a framework set by the CDC, but I've highlighted the family engagement because when they redid this model quite a few years back now, it used to be 8 components, and then it grew to 10, but it really didn't grow as much as they separated out community involvement and family engagement into 2, and they kind of shifted 2 others around. But I thought that it spoke a lot on the importance of family engagement, right? They separated out from just community and parents and lumping it together, really focusing on the need to integrate our parents into the decision-making, into, reflecting the values of the community, into bringing in their expertise and sharing programs that they maybe have heard of from another school. So excuse me, again, the family engagement piece on the WISC model, I think just speaks volumes. Okay. I know it's early in the morning, and I asked Michelle if this would be a good idea or not, but I want everybody to stand up and we're going to read this story out loud. So if Melinda and Sarah, if y'all will unmic to help me read this together, so it's not just my voice, but I want everybody else to be reading it too. So go ahead and stand up real quick. Okay, and we're not just going to stand up, but I'm all about integrating in movement. We want to do this in schools as well. And we're going to read a little story, everybody. So I hope everybody's standing. I can't see you, but I'm trusting you, right? So we're going to start marching in place. We're going to march in place, and we're going to start reading this together, Melinda and Sarah, okay? Whose job is it really? This is a little story about 4 people named everybody, somebody, anybody, and nobody. There was an important job to be done, and everybody was sure that somebody would do it. Anybody could have done it, but nobody did it. Somebody got angry about that because it was everybody's job. Everybody thought that anybody could do it,
but
but nobody realized that everybody wouldn't do it. It ended up that everybody blamed somebody when nobody did what anybody could have done. All right, we can sit back down. All right, our little activity break for the morning. But I share this a lot in presentations, and I think, again, we're all very guilty of this, right? You know, you think the school's doing something, schools think the parents are doing something, and it truly is everybody's job, not just one person, not just a parent representative or a healthy lifestyle chair on a PTA. It's not just a SHAC member. It truly is everybody's job to help educate that whole child. All right, so PTA, like I said, has developed a lot of resources to help support health and wellness. They do have a position that you can have on a PTA called a Healthy Lifestyles Chair. I will be honest, you're not going to find a lot of those positions because I think it was Sarah that mentioned, that volunteer fatigue. It's, trying to get enough volunteers to sometimes just manage some of those bigger positions. But what we're also trying to do is reiterate, you don't have to have a Healthy Lifestyles Chair to integrate in health and wellness. It could very easily fall in to a VP of programs person, somebody, with fundraising and, just offering healthy fundraisers. So health and wellness is intended to be integrated in a variety of positions, but we do have resources if you have a Healthy Lifestyles Chair, and there's a lot of good ideas in there that anybody could use. We break down effective categories into these 5 areas, and we give them concrete ideas of how they can start at a beginner, intermediate, and advanced level ideas for communication, supporting partnerships, participating in programs, celebrating success, and then lastly, advocacy. Texas PTA and national as well are huge advocates, as going in and talking with legislators and legislative sessions, on a variety of education topics. So that we really, again, don't want parents to be scared and kind of taking that next step to the SHAC and joining the SHAC. We actually recommend as an intermediate level, because if they're just starting to tiptoe into their PTA, they may not be ready to commit to another meeting, another group, and so, but it kind of helps them tiptoe into that advocacy world. We also offer suggested monthly coordinations. We had a newsletter that was going out that offers ways that you can help coordinate with your nurse or your counselor on the campus, or your PE teacher. If it was, National Dental Hygiene Month, maybe you work with the nurse to come up with some sort of, promoting water campaign, which, you chart that and they turn it in for prizes and such. So again, ways to kind of rally around some of those national observances and getting it, again, coordinated with the school. And so that's part of the resource guide as well. And a lot of some of the other ideas are just incorporating health into existing events. A lot of schools have math and literacy nights. So, kind of how can we don't need a standalone, health fair, right? That's possibly not going to be well attended on an elementary level. We do see a lot of successful ones when high schools do it and they have feeder patterns attend. But just think about what they're already doing and ways we can integrate in, such as incorporating movement like we just did. If it's a literacy night, having movement-based stories, selling healthier foods, promoting mindfulness. So just, again, baby steps of starting with what you're already doing. And then again, thinking of out of school time, right? There, during the summer, during the winter breaks, during spring breaks, utilizing calendars and other things like that are free to give parents and families something to do when they're not in school. Fundraising, again, a huge one that we talk a lot about. There are a lot of unhealthy fundraisers out there, but there's fortunately a lot of healthy ones, more so now. So we kind of delve them into 3 categories: healthy food fundraisers, non-food fundraisers, and active fundraisers. And we have more information about that in our resource guide as well. And we have, to give you a myriad of A to Z ideas for those healthier fundraisers. I know we talked a little bit about Shack earlier. Melinda was mentioning that as well. And we talked about it yesterday. But just again, if we've got somebody new on the call, to reiterate, a Shack is a required council for every district. So district, not campus, one per district. It has to be a majority parents. They are required to meet at least 4 times a year, and some Shacks meet more than that. They're advisory council, right? And so they are intended to have varied representation from around the district, and they provide recommendations to the board. And that's how they can leverage support with, again, evidence-based ideas, programs, research to say, look, this is something that we've, studied a lot this past year. We really would like to implement this within our district. So pretty much all things health related have to go through the Shack, from adopting new health ed curriculum to recess policies. And again, like I said, Texas law requires 1 per district. So little snapshot again on what a Shack is. Again, some of the other things Texas PTA is doing, National PTA has had Healthy Lifestyles Month for quite some time. And so Texas PTA, we've kind of added some resources to what they have and pushing this out throughout the state. But we have a toolkit that is very flexible. You can use various pieces in it, from morning announcements and sample social media blurbs to, this is an example of a home flyer they can take home. And for example, at our school, we're having any kid that brings it back. We've partnered with the PE teacher and just bought little trinkets and, doodads and stuff. And if they turn it in, they get a prize. We're also enticing our teachers this year, so really incorporating that staff wellness, that if they do this, they can turn it in, and we're raffling off a Stanley Cup. That was a big hit last year. But there's another resource in that toolkit of what teachers can do in the classroom, from everything from increasing your brain breaks to playing with your kids during recess, teaching a health lesson, right? Because a lot of the times that may be defaulted to a PE teacher, or it's not being the way it taught intended, because our classroom teachers do have so much on their plate. So there's a school one and the home one. And so if the teachers turn in the school one that they've checked off and done all of those, we're going to raffle off another Stanley for them. But lots of good ideas. Oh, and I didn't say Healthy Lifestyles Month is November, so it's coming up. It's right around the corner. There's still time to plan. And even if you do the littlest of things, Texas PTA is having a prize drawing giveaway. So again, if you just do some social media posts and morning announcements, you can enter into the Texas PTA drawing for a prize package that would be announced in December. A couple of other programs coming out are the Connect programs, which are intended to be parent education programs, where they take content experts on a variety of subjects and are able to be delivered turnkey, after school. Maybe it's a PTA meeting or a principal coffee talk. And so it's everything from mental health and wellness to financial literacy. A lot of good secondary programs are in the Connect, and they have like a 1-pager Q&A for a facilitator to kind of navigate that program. Very easy, and it's got a video vignette of the content experts speaking on that topic. So they don't have to be the content experts, right? Our newest one coming out is on vaping, where we partnered with Catch and Catch My Breath. So be on the lookout for that. And then lastly, Veggie Star is a fun program for the elementary, where it's, again, just a turnkey program. We give the schools ideas of how to implement using volunteers coming up once a month to identify kids that are eating their vegetables. They receive a ticket, and if the tickets are collected per grade level, they can be then turned into somebody at the school, and then a ticket is drawn per grade level, and that child can win a free recess for their entire class. We give a lot of other examples of how they can do it, but that's the way it's intended. And again, just a way to increase parent volunteers on your campus. They want to come up and see their kids during lunch, and utilizing vegetables, because again, it was the least controversial topic, because it's, every kid needs to eat more vegetables, right? And so that's how we kind of landed on veggies. But again, a very turnkey program that they can just read the resources and start implementing on their campus. Lastly, National PTA continues to grow and expand their resources for healthy lifestyles. And so they have the 3 pillars of healthy bodies, healthy minds, and healthy earth. And each area has lots of great resources that I encourage you to check out as well as other programs and resources linked to safety and other health issues that go a little bit beyond, just our basic healthy bodies, healthy minds. All right, so where do we go from here? I would say if you have a PTA or you're a school that has a PTA, consider adding a healthy lifestyles chair, and that you can easily do that by amending your standing rules and get that person in and be involved on the board. And then lastly, just I keep calm and play on, right? I think that if it's, I kind of go back to the catch motto. I was always said this: if it's not fun, it won't get done. And I think it's got to be fun for parents. It's got to be fun for schools. In fact, I just had a conversation yesterday with our PE teacher, launching, sending out the flyers to the teachers, and I said, do you want to write the email or do you want me to? I don't want it to be like the PTA is telling them what to do. But at the same time, we want to support. And so we want them to have fun with it, right? Like, let's raffle off and get some prizes. And hopefully they will have fun with it. Then the kids have fun with it. And it's just sort of that trickle down effect. So got to have fun. That's my ending slide there. All right. I was trying to rush at the end because I want to get now on to our other panelists to just dive a little deeper into some of the family engagement opportunities that we have on schools. But hopefully that gave you a great recap of what PTA is doing to support. And we encourage you all to go check that out. There's a lot of resources on the website. And I'll pop that into the chat a little bit later as well. All right, so we're going to start with a couple of questions. So I know, let's see, Sarah, I started with you introducing. So I'll start with Melinda on the first question. So does your school have a wellness team that requests parent support or involvement? How does that work?
Our school, they do, we do, but it's usually done through the PTA. So we work very closely with counselors to figure out what they need. We do like a lunch and learn where the principal comes in and we'll get together and work with the counselors and PTA membership and decide, whether they want to talk about vaping or mental health, gun safety, just a different variety of topics. We may also do something at a general PTA meeting at night. So we try to do, interactive things like that, but through the vision of what counselors might think that parents might need, but also what students might need as well. For instance, we're working now with counselors and the campus to put together a program called Shattered Dreams, which is a 2-day event that happens on campus. Reenacts a car crash. It's a huge production, but and that's something that's particular to our campus, and particular to what we've decided is, an important topic for students to talk about. But yes, we do. I mean, we don't have a healthy lifestyles chair. And I've been the smart driving sponsor for 13 years now when I started it in 2012. But we do a lot of those programs under the programs VP. So we're always, and we do a lot of try to figure out what people need and what topics, like vaping. When the House bill came and the vaping consequences were changed, that was a big counselor, mentioned need. So we did a program on that just to make sure that parents were aware that the legislation had changed in regard of if a student's found with a vape. So we really try to. And we're lucky. We have a great PTA. It's very strong at my high school, and we have a really good sort of kinship, friendship, partnership with our administration. They've always been extremely supportive of what we've determined, either by ourselves or with parent engagement or through the counseling department might be a topic that we need to bring to the campus.
I think that last piece was critical, right? You have to have that partnership with administration. If they don't have that buy-in, you can be pushing these things all day long and it's not going to get done if you don't have that buy-in. So definitely a critical piece of whatever that wellness team would be. And so you mentioned, on the high school, are your elementaries required by the district to have a wellness team with coordinated school health requirements, or and this is just something y'all do extra at the high school because it's not required?
Yeah, our district does. I mean, I don't know that I could, it's been a long time since I've been in the elementary sphere, but we do have there is a district webpage that has, health, dealing with challenging family situations, all those kind of issues. And that is then reflected or part of the website for each campus. So those resources are available there. So yes, it's as far as through our district, there is that wellness component found somewhere. It doesn't necessarily it's a PTA part of it, but it is a district part that there is that sort of information and those resources available on each campus's website.
That's awesome. Again, so you kind of got that partnership from both sides, the ask from the district and the ask from the PTA.
Right. So it's there as part of the district, but then on some campuses, not all campuses, then it's just kind of further supported through. And like you said, like you can have a PTA, you can have the campus, but when they work together, there's just that many different more avenues that you can reach parents and approach parents. Some parents aren't comfortable speaking with administration, but they'll speak to a PTA member. So it's nice to be able to have both those spaces where parents can come and be comfortable.
Absolutely. And having that synergy. Well, thank you. All right. So Sarah, same question, wellness team for you.
So unfortunately, our school does not have a wellness team. We haven't had a healthy lifestyles chair really ever. So one of the things that was brought to me as I was rising into the president of our PTA, I was approached by our specials teachers and they said, we need somebody on the PTA who's going to help us. And so that was one of the things we added to our school's PTA, was somebody to coordinate with our PE teacher and help be just that touch point to connect, because that had not existed prior. Everybody has a room mom, everybody has good connections with their homeroom teachers, but the PTA and the PE teacher and the counselor, we had not been talking much. And then on the SHAC side, our SHAC we don't have wellness teams in Richardson ISD. And so one of the things that we did last year is we put together a survey and we asked the principals, like, can you please tell us what is going on your campus? What are the priorities? Do you have any health and wellness team in place? And so we are asking them to kind of help us so that we can go to the board and say, we need this needs to become a priority.
Yeah. And so serving on the shack with Sarah, I think this was a big step for our district, because we realized there's a lot of principal transition. And so educating them on, hey, we have a wellness policy. This is required by law, right? And so creating that survey based on our wellness policy to just, kind of educate them. So there was sort of that beginning of the year, just FYI, and then we're going to, ask them those questions at the end of the year. And we were fully intended to have this not be a I gotcha moment, right? This is, hey, if this is not getting done, what can the district do better to support you? And how can we help find resources to help you get this done? So just to echo Sarah, I think that, now we've kind of taken those steps to have them, identify a wellness team when they do fill out this survey. And I know, a lot of districts from around the state do it different ways. I've seen some campuses where their SHAC has actually gotten stipends for having a wellness champion, and you have that wellness team. You have them, as part of their coordinated school health mandate, and they have, robust meetings, or it can also be tied to more of like a site-based decision-making group, and wellness is kind of weaved into that group as well. But just to kind of reiterate what Sarah and Melinda said, I think, if you don't have that on your campus, just kind of taking those baby steps and, trying to just pick those key leaders, your PE teacher, your counselor, your nurse, and just start talking. And, maybe it doesn't have to be a formal meeting, multiple times a year. Maybe it's a touch point in the beginning, in the middle, helping them coordinate events like Sarah said, or, Melinda saying that, asking them, what do you want to focus on? What is the main priority of our school at this moment? And how can the PTA support that, right? So having that dialogue and discussion to really find out what's mattering most. And that shattering dreams, I wrote that down, Melinda, because I knew somebody who did that a long time ago. And I kind of forgot about it. And now I want to revisit that with our shack. So kudos to y'all. I know y'all have done a lot with safe driving in Northeast. So that's amazing. All right. So next question, and I think I know the answer to this, but just to have y'all share a little bit more. How does your PTA, and if you for PTOs that could be learning, support health and wellness beyond district initiatives, right? So we've talked a little bit about what the district is doing and how the PTA is supporting that, but have y'all done some things outside of those district initiatives that your PTA is supporting? So Sarah?
Yeah. So, our environment around our school is very walk friendly. So we had the walk to school day, walk scooter. We actually had the Richardson City Council. They reached out to us and they said, "Can we come for your walk to school day?" And so we were able to say on social media, "Hey, if you walk to school, if you scooter to school, they'll be there. They'll be handing out stickers." And so we really try to amp up those opportunities for health and wellness. Our Red Ribbon Week is one of our big things. I know that is a PTA thing that is pushed. And, since we don't have a health and wellness person, our programs chair is in charge of that. And so we make that a big week for us. And again, going to the Healthy Lifestyles Month, our school, unfortunately, in November is just too busy for that. But I'm able to get the PE teacher to buy in on bringing it in the spring. So we are trying to bring it in when we can. I feel like it's kind of that, if we can puzzle piece it in anywhere, I will take that. We will take our steps where we can get it. And I feel like that's kind of, as a PTA leader, I don't ever want it to feel burdensome to our teachers. Like, I want them excited to work with us to do these things, because then we can kind of build together to make that a priority.
Absolutely. We don't want it to be one more thing on their plate, but I love the way you said puzzle piece it together, right? Because we have to get creative. And they've got so many things on their plate, and with y'all being a smaller PTA, trying to squeeze one more thing in, if it wasn't conducive. And so, yeah, it's like, find it if it works for you in February, and that's where the best place is. I say go for it. I think anytime that we can help, like you said, extend those messages that the school isn't quite getting to, like the walk to school day, just partnering with your city council. I think that was a great idea. So thank you. All right, Melinda.
Yeah, we also helped out at the walk to school, and what we do a lot is partner with community partners like Safe Kids of San Antonio. So we kind of share their wellness ideas with the different campuses that we can. And so my club students partnered with an elementary school, basically supported that walk to school idea, but we did that with the partnership of Safe Kids SA, which is really fun because they gave the kids vests and glowy lights and things like that. Yeah. That was a way that we kind of partnered and took the health message off our campus onto one of our cluster schools, which we do a lot of that because we believe that it's, good to share that information and build those relationships. We have a parent page that if the district or our campus is focusing on something, we have a fantastic PTA president who is awesome at keeping up with all the things that are going on in campus, health and otherwise. And so a parent page is a really interesting place to push or promote whatever we're focusing on and wellness in other areas, because it kind of creates a conversational space. So you get a lot of positive feedback. There's some negative feedback, but you get it's a good way to engage parents and to get kind of give them a space to ask questions or, figure out what's going on in campus and stuff. So that's one of the places, just the use of social media, but really to move a wellness message off our campus. We just engage a lot with local leaders. We get a lot of support through there. And that's just another avenue, another place in social media where we can share those messages. We did that with the vaping campaign, and our local district council person was really good. It's just as simple as a repost, or they'll include what we're doing on campus in their District 9 newsletter. And with that, just teaching our campus, our students, who their local leaders are and how, and that's probably the advocacy hat coming out in me too, but just to engage in that process, and sharing that information, that safe driving information, whatever other wellness information, and just figuring out a different place to put that message. We worked with our District 9 person and made safe driving signs. And they helped us. My student designed that, they funded it, and we got to get around our entire community. So we took that safety issue and pushed it way out, which is one of the big things that we've always focused on with the club.
I love that. And you said, from everything from focusing on the clusters, reaching out to the schools around you to kind of help partner those efforts, you just make truly a bigger impact. And then engaging those students. I think we on the recap this morning, we talked about students being those change agents. When we can, empower them and give them the resources, the sky is the limit on where they can take it. So making those signs and being able to make it visible, well past just what the district and school is doing, we have that larger reach. So kudos to y'all as well. I think that sounds great. And I was just thinking also what y'all said, just reaching out to local leaders or local businesses. One thing that this was kind of an 11th hour idea that I had with our council. And I don't know if we went back and clarified this earlier. Our council is a district level PTA. And again, not all districts have that, but if they're a more higher functioning PTA group, they're going to have one at the district level as well as all the local PTAs. So Melinda and Sarah and we all serve on the council as well. But trying to work with local businesses to give prizes. And I mentioned Texas PTA is doing this for the entire state for anybody who does it for Healthy Lifestyles Month. So I kind of wanted to mirror that in our district. And so I was able to get a local running shoe store to donate a free pair of shoes, grocery store, a gift card, for groceries, and then another one for urban air to kind of have a family pack to get kids moving, but again, and then what we're trying to do is tie it with ideas that if a local school wins it, how you can utilize these local businesses to entice parents. Even with the gift card for groceries, one of the ideas was buy healthy snacks for your staff, right? If you don't have the funds to do that, here could be a way to treat your staff with some healthier items, or offering taste tests for the kids and such. So really tap into those local businesses in your community as well. And I think that's part of that outreach that parents groups can have well past just, what the district is doing. So excellent ideas. All right, let's see. Next question. How does your school or district communicate and engage parents around their health and wellness issues? So some of the great things that your district is doing, what are some of those avenues that they use to help communicate? I know we've talked a little bit about social media and, your district page. But so Melinda, I may just come back to you because you are already on that. So is there anything else that you could share that what they're doing for other initiatives and how they outreach to those parents?
That's me.
Yeah, sorry, Melinda. Yeah.
Sorry. Yeah. So we have a great principal. So at least on my campus, it's super easy. He puts out a JAG News newsletter every week. So that's one really good that goes to every single parent, which is fantastic. We have 3,200 students on our campus, so that's a lot. That's a big outreach. So that and he'll talk about anything, safe driving, gun safety, mental health, vaping, all those. I have a lot of different groups that I work with through my advocacy in the Safe Driving Club. So, that's a lot of from hospitals and law enforcement. So they're always putting out good information that I can then share. So that's a really easy avenue to share information from. So that's probably the easiest one. Our district's really good. Our superintendent does a weekly message where he'll get up and talk about the district and different, for instance, he put a big message when the vaping legislation changed, which is really good. I mean, you can have it at the local level, but I think it's important too when it comes from the superintendent level as well, from central office, just so people understand the importance of it. But, and again, we mentioned that through our council, through advocacy and healthy lifestyles chair on council. So really, at a local level, and we've kind of developed relationships with our cluster schools. So if there's something that, applies to the littles all the way to the bigs, then, if it's an event, a wellness event, I get a lot of those, especially when we were on SHAC, we were always getting information from the American Heart Association and different groups about walks and runs and different activities that were going on. So my district, at least I can say, is very open to sharing information for the health and wellness of their students, staff, and families.
That's amazing. I think and it's very evident that it's mirrored from top down, from your superintendent all the way down to the local principals. And when you have that support from all those different areas, those messages are going to get out. And it sounds like y'all have a robust way of sharing those messages as well. Mm-hmm. Thank you. All right, Sierra, same question.
Okay, so I'll start small first. So our principal at our elementary school has been very good about making recess a priority and about making brain breaks and meditation a part of classroom experiences for our kids, which I absolutely love. And then if I'm talking about the district, we do have Live Wise, Live Healthy, which is a Richardson ISD initiative that is every month has a different theme. So right now, October and November is grouped together and it's Be Kind to Your Mind. And so that talks about the Red Ribbon Week and then anti-bullying. And, in the beginning of this semester, there was a program that was held at our high schools. And so that was how they were trying to drive traffic to them. It was held at, depending on where you were, your feeder pattern was. And I will say, I appreciate that I have seen improvement in the way that our district talks about health, and this theme I feel like has been great. But I will say, as an elementary school parent, I feel like it's so much more targeted to our older students, and I think that's an area for growth for our Richardson ISD in particular, is that we can do a little bit more to make sure our elementary schools are also getting that messaging around how do we take care of ourselves, as not just in our mental health and but we're also talking about how we make healthy choices in the foods we choose, making sure every principal is making recess a priority for all these kids and making sure everyone gets their PE minutes and that kind of thing. Because I do think there is some room for improvement there for our younger kids. And I haven't experienced this in particular, but I know sometimes they can lose that because academics is such an important part of their school day. And those test scores are so important, but sometimes they lose out on some of that physical activity because that is so, it is so important to the success of our schools. And so I do think that that is somewhere where we can see a little bit more support for our elementary school students.
Yeah. And I think that brings a great point to where districts can, look at kind of like Melinda was saying with the cluster schools, but to Sarah's point, if it's at a high school and it's, harder to access from the elementaries, maybe we look at how we can offer more things, some of them be at elementaries, some of them be at the high schools, maybe at the middle schools, and kind of just shake it up a little bit. Because I think it comes back to that multifaceted approach, right? Like, don't just send an email out nowadays, right? You got to send an email. You got to send a Facebook post. You got to do an Instagram post. You got to tweet it. You got to find all those avenues to be able to reach parents. And unfortunately, it's a little bit more work, but in the long run, it can have more bang for your buck if we're being able to use a variety of means to reach parents. You're going to just have that larger reach. So, all right. Thank you. I know we have a few more minutes. I want to get to one last question and then maybe we can open it up for Q&A. But y'all both talked about your shacks. I know we've, mentioned a lot of the great things you're doing, but just coming back to how they're providing input on critical child health issues, what are some of the, great ideas that your shack is doing to present that information to you? So, Sarah, since I started with Melinda last time, I'll go with you first.
So I think, when I saw the email come across that was, Shack is something that is open and we're looking for volunteers. And I felt like that was a great way for Shack to reach out to the community. And I do think that that is the best way to reach parents is, like you said, all those different avenues. Like we do need to make sure we're putting it in not just one email, but maybe it has a place on our district websites where they can say, are you interested in this? It's, here's our open time to reach out and get more information, or here's where our minutes are and things like that. Because I do think that, like you said, parents aren't necessarily going to go looking for that information. We need to make sure that we are putting it out there multiple times. RISD has a great app where they this year have rolled out, and I feel like that is an opportunity for Shack to be putting the stuff out as well. But I feel like the way that we partner with our schools has improved. So I feel like Shack is the reach that we've had with our principals through that survey, I think is also going to help bridge that gap as well.
I do. I think it's, it's kind of that slow and steady snowball effect, right? You start little and you just start with those baby steps and it starts snowballing from there. And I see that Michelle, before we jump to you, Melinda, Michelle dropped in the chat the Texas Shack Network, which she said, you don't have to be on a Shack to join, but it's again a great resource of where you can connect with other people around the state who are on Shacks. And Sarah and I were talking yesterday about, because I was sharing some of the great information on the first panel discussion and the Shacks that they mentioned. And having some sort of, mentor person from a different district, that we can, call on and reach on. So that Shack Network, if you haven't checked it out, I highly encourage you to do that. All right, Melinda, what are some of the ways that your Shack is providing input on child health issues? How do they arrange their meetings? What do they bring in?
I'm not on Shack anymore since my last one graduated, but when I was last year,
Yeah.
I was on the Healthy and Safe Schools Committee. Of course, Shack deals with the sex ed curriculum. That was a big thing that we were working on when I left, but also more recess. There's a committee there trying to figure out a way to get more recess for the elementary kids. On my committee, we were trying to get magnets, I guess, or stickers to put out throughout the middle school and high school campuses with the 988, the suicide prevention hotline. Just to have that stuck somewhere in the bathroom or in the hallway or somewhere, primarily in the restrooms. We were trying to work on that. Also to have, we have a see something, say something tip line for anything that's concerning. So we realized, if a kid has an issue, they're not going to call the hotline actually dial the number. So we were working on developing an app that could be downloaded through as part of the counselors when they come in and do different programs with the students. So we're working on, which they're still doing, developing an app that the student could download on their phone. And so if they had a concern, they could approach the hotline, tip hotline that way. So those were just some of the things that we were working on. I know they were also trying to, we have with the Healthy and Safety Committee working on air quality in schools through one of the groups that we were working there with, were coming in and doing programs where they, the asthma group, and I forget what the society is called, but they would come in, and especially at the elementary level, and do this program where the kids would go through this tube or whatever, and it would get, smaller and smaller and smaller, just to kind of reenact or to simulate what it's like to have asthma. So that was a big thing that we're working on, trying to go through and check all the air quality, installing, I think they have these little meters or something that was part of one of the things we were working on to get those installed at all the campuses to help monitor air quality.
Love that. Great ideas, both of you. I've just thoroughly enjoyed and I've been writing notes myself on just some of the, wonderful ways again that we can just continue to bridge that gap with, the disconnect sometimes that happens with parents and schools. And again, being that parent now and sometimes getting that Tuesday folder worth of newsletters and half of them go in the recycle. I mean, it's a lot. We know it's a lot. And so, and we are parents who are passionate about health and wellness, so my thought is always the parent who that's the last thing on their radar, right? Like, how can we help reach them and just kind of get them those little small chunks to not overwhelm them, not make anything seem like, a gotcha or you're doing things wrong. It's truly, hey, here are some resources we want to share, and hopefully one of them could benefit you, right? And so from sharing all the great things that your districts are doing and how the PTA support that, or on the flip side, the programs that the PTAs can bring in that the district aren't doing. I think you definitely need both to help grow and expand those messages. So I know we have a few minutes left. Michelle and Alice, do we want to open it up for any questions? Is there anything? I was kind of checking the chat. I don't think I saw any other questions in the chat, but any last tidbits of advice or just questions that y'all might have lingering that want others to know, Sarah or Melinda?
I'll just say that I think PTA has changed, and we're a real support net for campuses, and I think more and more campuses are starting to realize that, and I think more parents are starting to realize that PTAs have changed. I mean, we've always remained, but some people have certain perceptions of what PTAs do.
Yeah.
But we're a huge advocacy force, and like you said, we can bring in programs and support resources that the district may not be able to. So I think at least in my experience, is that they are starting to rely more on that necessity and that ability.
Agreed. And I'm not going to discount for those, out there listening right now that, yeah, I truly agree with you that there sometimes is that negative connotation with PTA. And I think it comes, it's always a couple of the bad seeds. But I think that image is changing. I think, even if you just join your local PTA and you pay your $7 or whatever it is, collectively, then that can be used even at the state level, because the more members we have, going in and telling legislators that you've got, 500,000 parents that are against this, legislative policy that they're bringing forward, they're going to listen. So that's part of that powerful voice that you can have by joining your PTA. And again, bringing in programs that they can't. Sarah, any other last minute ideas from you or thoughts?
I think I would just say that from where I sit, there's always room for growth, but I think we also need to celebrate our victories when we have them. So I think our shack, we are trying to really get going. We're starting with our survey, and we are looking forward to what kind of growth we can do in our local PTA. We don't have that person in the seat right now, but maybe we can divvy up that job, and we just have to keep looking towards where we want to go. And I think it is important that we praise our staff, like our district staff and our teaching staff, that are willing to go there with us and that are open to that communication, because we all have the same goal. We want healthy kids who learn well at the end of the day. And I think keeping our eyes on that goal is really what helps us all be successful.
Absolutely. And I love how you touched on celebrating even the littlest successes, right? We always want to have room for growth, but, cutting back to the fact that, Richard's, our shack kind of took a hit with COVID, right? And we're trying to build it back up. And so you have some districts that have very robust shacks and have for quite some time. But for those that may be a little bit smaller districts, and maybe you took a hit during COVID, I think, like she said, our district has a very robust Live Wise, Live Healthy. They do other programs like RISD rides with, and it's tracking, any type of movement throughout the year with bicycle riding and such. We do the 21-day challenge, which is, again, expanding. It's here in the DFW area, but that's expanding to around the state as well. So they do a lot of wonderful things. And I think, like she said, with this survey now, we're only going to help expand that message to principals that may not have known that, okay, these are things in place. And, I need to remember to do those brain breaks, because that's part of our wellness policy. So definitely celebrating those successes, but always looking for ways to grow. Let's end on that. I think that was amazing. All right, Michelle.
What a great group. Thank you all for sharing your time and your experiences. I think it's extremely helpful, and PTA has been a strong partner in helping us grow parent participation. And, y'all are perfect examples of why it's so important to get PTA involved. So thank you for everything you shared this morning. I think it's been a great session. Karen, you ended exactly on time. It's just, you are so good. We're going to take like 5 minutes before we start our next session. So you want to take a quick break, get some more coffee, get rid of some coffee, and then we'll get started here at 10:05 with our next session. We will have a catch break, but we had scheduled that for after the next session. So any of you that were here yesterday, we had fun counting steps, and I was very bad at estimating. So we'll see what Chad has in store for us today. So thank you all very much. And
thank you for having us, Michelle. And thank you for putting on this summit. I think it's, for those who maybe this is their first year, I mean, we've continued to it, and I learn something every year. So just kudos to Texas Action for Healthy Kids and the amazing work y'all do as well.
Thanks. All right. We will see y'all back in 5 minutes.
Thank you. Thank you, Melinda and Sarah. Can you hear me?
Yes. Welcome, everyone. Welcome back. We are going to start our next session. We're excited to have Department of Agriculture has put together, I think, a fabulous presentation for us. Jenny Langell.
You had it.
Okay. Has brought together a great panel, and I'm going to let her introduce them and take over. So go for it.
Thank you. And good morning, everyone. Thanks for coming to this presentation on enhancing and promoting school meals. My name is Jennifer Langell, like she mentioned. I'm with the Texas Department of Agriculture, and I'll be moderating for you today. So as Michelle already mentioned, we'll have the presentations recorded, slides available after the summit. And I just wanted to mention that we will be going through our presentations separately, and then at the end we'll do a Q&A session. And so today we're going to hear from me, hear from Florence ISD, San Antonio ISD, and share our strength. So for introductions, you already heard about me. I am a food system specialist with TDA, and I'm going to talk about how on a state level, a state agency helps to enhance and promote school meals. Then we're going to hear from Lillian Barnett, who is from Florence ISD, and she is going to be talking about how she incorporates local foods and also collaborates for recipe development to enhance school meals in her programs. And then we're going to hear from Jenny Arredondo, who is from San Antonio ISD, who is going to talk about how she incorporates culinary programs and culinary collaborations to enhance school meals in her program. And then finally, we'll hear from Stacy Sanchez-Hare from Share Our Strength, and she's going to talk about how her organization helped to advocate for and increase access to school breakfasts to students in Texas. So before we begin, if I can get help in sharing our poll, we just wanted to do a quick poll to see who's in the audience. Who are we talking to today? I know we've seen a few different school districts and some SHAC members and PTA members, but we'd really like to know, who is here today. All right, thank you for that. And we'll look at those responses in a minute. To keep us moving on. Is the poll still going, Michelle?
We're up to 76%. We're getting close.
Awesome.
78. We can call it.
Yeah, let's call it. And we'll look at those poll results later. Thank you so much for. Oh, here we go. Okay.
Sorry.
So
We've done it too fast.
Okay, great. This looks great. So other, okay, if you put other, if you don't mind putting in the chat box, who you represent or who you are. So we can know what you're coming from. That would be great. Thank you. Thanks for sharing.
Okay.
I'm trying to hit the advance button.
Oh. You have control of your PowerPoint.
I do, and it's not
No.
wanting to. Let me try this. Okay, here we go. All right, so today I'm going to talk a little bit about TDA, about who we are, what our mission is for those of you who aren't familiar, and then a little bit about school meals for those of you who are not familiar with what types of things go into making a school meal. So that way, when you hear our wonderful panelists talk about how they enhance and promote school meals, you have a little bit more of a background. So I am from the Texas Department of Agriculture, specifically the Food and Nutrition Division, and we work to administer 12 different federally funded child nutrition programs. And our vision is really to increase equitable access to those healthy meals for Texans through these programs. And really our job is to support providers and operators of these nutrition programs through ensuring accountability, efficiencies, and accuracies when implementing these programs in Texas. So here are the 12 different programs that we administer, and across the year, this results in about $2.5 billion in federal funds that are used to implement these school nutrition these child nutrition programs, excuse me. And the ones we're really going to focus on today are the National School Lunch Program and the National School Breakfast Program. So here I have a little bit more statistics specific to Texas in terms of these different federal child nutrition programs. So overall in Texas, we serve about 836 million meals and snacks every year. And in terms of daily service, we're serving across Texas 1.6 million school breakfasts, 3.1 million school lunches, and between school operators and community operators, we're serving almost 400,000 summer meals every day during the summer. And so, why does this matter? Why is this important? Well, 20% of Texas children experience hunger, and 65% of Texas students qualify for free meals. So as you can see, there is a need for these child nutrition programs, and our school operators and community operators are trying to provide healthy, nutritious meals to students so that we can help with these issues of hunger that they go through each day. Like I said, I wanted to give, before we get into enhancing and promoting school meals, I wanted to give you a little bit more information about school meals in general. So here I have a little slide about school meals in a nutshell. So as I mentioned, these programs are funded by USDA, and TDA administers these programs and regulates them. These child nutrition programs have to meet very rigorous nutrition standards. This is not the school lunch that maybe you grew up with. It's very different now. And so I'll go into a little bit about that in a second. Also, school meals help to alleviate food insecurity and poverty. There is a lot of students in our state that suffer from food insecurity and don't know where the next meal is coming. So being able to provide them nutritious meals that are accessible to them each day in school is incredibly important to help alleviate that hunger. Also, school meals support good nutrition. There's been a lot of recent research to show that school meals are healthy and very nutrient dense, and that can be healthier than things people are bringing from home. And so making sure that we're providing good nutrition for students that may not get it outside of the classroom and outside of school is really important to their health on long term and also for their learning. A hungry student can't learn. So these child nutrition programs are very important in making sure that students are able to get the nutrients they need to learn and thrive in school and beyond. So just to give you one more little piece about a reimbursable school meal, what it takes to make a school meal. I have a little graphic here to show you the different components that are required to go into a school meal and a school lunch. So we have vegetables, fruits, the milk component, grains, and a meat alternative. And so on top of having to include these components into school meals, in addition to child nutrition operators also have to meet very rigorous nutrient requirements, daily and weekly requirements about the types of foods that they're serving, and also the nutrient specifications. So how many calories, how much saturated fat, how much sodium and trans fat. So there are a lot of things that go into a school meal. And so keep that in mind as you see how our panelists are creatively enhancing and promoting school meals. So how does TDA support school meals? I'm going to talk to you about a few of the umbrella ways that TDA tries to help support school meals and support districts. And I want you to keep in mind that this is all under the banner of collaboration. We collaborate with school districts, community organizations, school staff, and administrators. It really takes a village to be able to help to promote and enhance these school meals across the state. So in terms of promotion, TDA promotes a lot of different programs and recognition programs to bring awareness and educate and increase participation in our child nutrition programs. So for instance, we just went through our National School Lunch Week celebration that occurred in the second week of October, where we promote school lunch, encourage students to eat school lunch, also recognize the hard work that goes into our school districts in creating those school lunches, and really bring awareness to the community about these programs. In addition, we have other programs like our Farm Fresh Network that we help to promote and collect farmers and producers information to then help create a resource for our schools to be able to work with more Texas farmers to be able to incorporate local foods into schools. Another thing we do is recognition. So there are a lot of USDA and or TDA created recognition programs. And the purpose of these programs is really to help inspire and encourage schools to do certain things to help enhance school meals. Like for instance, our Farm Fresh Challenge that we're going through this month is a program where we recognize and we also encourage schools to incorporate more local foods into their school programs. And so they're able to get different levels of recognition based on how much of those local foods that they serve on their menu. And then also we just went through our Turn Up the Beat Award, which is a recognition program for our summer food operators so that they can get recognition and inspire them to do above and beyond requirements to serve nutritious and quality summer meals. And I will mention the Healthy Meals Incentives, as Michelle mentioned earlier. That's another program that she is working with Action for Healthy Kids to help recognize schools that are doing above and beyond in creative ways to enhance school meals. And then just briefly, I'll mention that we have a couple of grants that we're doing to help enhance school meals. This is just a snapshot of the numerous ways and grant programs that TDA administers to help give funds to schools to enhance and promote their school meals. One is the Local Food for Texas Schools grant that we just started, where we're giving funds to schools to purchase local Texas products and put them in their school menus. And then the other one we have coming up is that Team Nutrition grant, where it actually is focusing on nutrition education for students across the state. And we're collaborating with different organizations like the Texas Agriculture Extension and also SHACs to help provide more nutrition education to students and the school community. And then finally, I just want to mention a grant program that we're just wrapping up that really envelops and describes the piece of collaboration that TDA is doing with schools and with other organizations like the Culinary Institute of America. This is a team nutrition training grant that we did. And I'm just going to give you a little teaser because Lillian is going to talk to you more in detail. But essentially, we help to do recipe development with our school districts to make recipes that were culturally relevant, using local foods and are school ready and student tested. And so our part in this grant was to help to standardize the recipe for schools and then create a training video, as you see here in the picture. But I'll leave it at that because Lillian's going to go into more detail on the school side of how we collaborated together on this project. So thank you so much for your time. I'm going to now hand it over to Lillian, who is going to talk about the ways that she is enhancing and promoting school meals at her school program.
Thanks, Jennifer. You make us sound pretty good up here in Florence. So just thanks for having me today. I have sat through a couple of these earlier parts of the summit, and they were very good. I was very interested to hear that, big part of our district is SHAC. We work with the PTA, all that cross-department collaboration, and it just all kind of comes full circle into child nutrition as well. Jennifer, if you want to, we've seen that picture enough. So we are a small district. We're about 1,200 students. We're located between Georgetown and Killeen, so we're just a little bit west of I-35. We're in that part of Central Texas that's growing like gangbusters. We are right now in the process of building a new elementary school, and it's going to be replacing the elementary school that we're in now. That parts of it were built in the 40s, and then they kept adding on, so we're pretty excited about that. We are in our 5th year of the community eligibility program. We're district-wide. We're about 65% free and reduced meals. So it was a great program for us to become part of. We do offer school breakfast. We offer the lunch, and then of course the after-school meals and snacks. And we collaborate with our after-school ACE program on that, who does a ton of community engagement, wellness initiatives, and that sort of thing. And we also do in the summer the seamless summer option. So promoting and enhancing school meals. This was, I've been doing this for about 15 years at Florence. Prior to that, I was in the for-profit world at HEB, and before that, 17 years with Chili's. So obviously the promoting and enhancing in the for-profit world was something that I kind of understood a little bit. So once I got up to speed on this whole school child nutrition piece of it, we really started working hard on improving what we were feeding the kids, the quality, the presentation, and all that. And it just goes hand in hand. If you're doing, beautiful food, that you go ahead and promote it. We do a lot of social media. We work with our BOTS, which is the Void of the Stampede, which is our high school CTE program. They do a lot of promotion for us. We help with community engagement. We just did a really exciting ESL, English Second Language, and ACE community engagement program on Monday night, where our staff worked with the ACE kids to actually prepare and then serve to about a little over 200 people for our community engagement event, and then learn how to clean up the kitchen afterwards. So that was a lot of fun, gets us a lot of good press in the community. And I think the families enjoy coming in and seeing where their kids eat, what their kids are eating, and how we're trying to improve nutrition and choice for the kids. We do work really hard on being creative. These are a few of our things. We work with some local farmers, Bolden Food Forest for one, Fifth Branch. We have L&S Farms here in Florence that provided us with pecans right up until they got caught up in a wildfire earlier in the year. But we really tried to use the ingredients that we have to make special items. And obviously these are all beautiful presentations, different items. Those are my spring calves, so I was pretty proud of those. So I'm also a producer here locally. But one of the things that we've learned is you can provide food like this for your kids, but you've also got to be a safe place. So for as many kids as you have that really like to be explore foods and be willing to try new things, you are going to have those kids that you have got to be a safe place for as well. And so although we don't promote the pizza and the chicken nuggets and the hamburgers quite as strongly as we promote some of these other special items, our kids know this is a safe place. And if they don't want a heirloom tomato salad for lunch, that they're going to be also able to come in and get their burrito or their chicken sandwich as well. So local Texas products, that's a lot of people are talking about buying local. You go into the grocery stores, you see all the Go Texan, all the producers and manufacturers trying to really get the word out that our food is local. And I don't think many times that people that are working in the school kitchens realize how much of their stuff actually is local. And if you just kind of look around, you can already start bragging about how much local food that you are serving. We track pounds and we track dollars. And we track where our stuff is coming from, and we're right about 30% right now local. We've been working with the Sustainable Food Center, who has helped us really get some tracking in place to make it easy, cool presentations. You can show it at your school board meetings and so forth. But I think parents really like it when I know parents, I've heard from parents that they really like it when we promote local, and the staff does as well. And if you tell the kids that their food was grown by a person that they can actually meet, that's an hour up the road, it makes kids even more interested to try some things that might not be usual for them. The pickled mushrooms was very surprising. Our kids munched those on the salad bar and they love those. So Jennifer, if you want to go to the next slide. So like Jennifer mentioned, we do work with a lot of different groups. This is the grant that we're finishing up. We did the local beef chimichurri rice bowl, which the beef was actually produced in our Florence High School meat market. The kids have a CTE program where they actually bring in whole carcasses of different species and they break them all the way down. So those kids produced that beef that you see in these slides here. And we had Chef Corey from the Culinary Institute of America come in last year and work with our staff on presentation, some basic culinary skills, knife skills, that sort of thing. And so we developed with her these two recipes. One is a Texas tornado queso, which was really delicious, and it's made with local mushrooms grown in Gonzales. And then the other one, like I said before, is the beef that is produced by our own kids. And so TDA came out, worked with us a couple of times, I think at least 3 or 4 times, because they were here on the actual first day that we prepped it, and they worked with the kids, mostly our ACE kids after school, to fill out the surveys and get the feedback. And then they came back this year to watch us actually menu the items, and interviewed and spoke to our staff about preparation techniques, and also talked to the kids. And I know that they visited with a table full of some of the fellas that actually work in the meat lab. And I think that the kids were excited to talk to TDA, and I think that TDA was excited to work with the kids so closely that day. So that was good. And so here's a little bit more information about our Florence High School meat market. Like I said, it's great community provider. We're probably 20-25 minutes to our local grocery store. So these kids can actually, you can have your personal animal taken and processed, and they will bring your carcass to the school, and the kids can package up your meat for you to take home, or you can just come by from the retail counter. So the kids are learning, of course, how to fabricate a carcass, packaging, customer service. They're doing the cash handling and the inventory skills and all of that. So this is a program that we're super proud of here in Florence. And that's really about all I had to talk about, except for, you know, just really working on those collaborations cross department, being involved with as many things as you can. Everybody likes to eat. So as many times as you can get your food in front of the community, in front of administrators, teachers, the better off you're going to be.
Thank you so much, Lillian. And I just want to point out too that Lillian is like the queen of grants and opportunities and funding. She is just amazing about finding ways to incorporate different types of funding programs and collaborating with other organizations to enhance the school meals at her school district. And she just does a really excellent job. And I just want to commend her on that. And say she also is one of the Healthy Meal Incentive grant awardees that Michelle was referring to earlier. So congrats to Lillian again on that. And thank you for sharing with us. So next up, we have Jenny Arredondo. And like I said, she's from San Antonio ISD, the Senior Executive Director, and she is going to talk to us about her program.
Good morning, everyone. Can you guys hear me okay? Perfect, perfect. So before I start, I have to tell Lillian I'm going to make a drive down there. That tomato salad made me hungry this morning. It looked great. But like Lillian and San Antonio ISD, we too participate in CEP. Our free and reduced population is probably about 80 to 92%. So we do have a high level of free and reduced students in our district, which means we're able to offer breakfast and lunch at no cost to our students. We also offer supper, snack, and summer meals at no cost here in SAISD. Our enrollment is about 45,000 students. We serve approximately 70,000 meals per day. We have a department that consists of about 500 employees and an operating budget of about $45 million. So that's just a little bit about the district. Next slide. I think this is really important, and this is our mission statement, and it's the mission of our department to enhance the learning and health of children by nourishing their bodies and minds through the availability of healthy, nutritious, and appetizing meals. And for the purpose of this presentation, I really want to focus on the appetizing, because these next two partnerships that I'm going to talk about really target the appetizing portion of this mission statement. And so the first is with the Culinary Institute of America. We partnered with them back in 2018, and we implemented a chef-driven cafeteria program. And so the picture you're seeing here is once the program training was concluded, we awarded all of our campus managers with a chef coat. We did a little ceremony with them, and it was really special. And the program itself was lots of fun. If we go to the next slide, I can explain a little bit more and show you some pictures. So first and foremost, the goal of the program was really to introduce more fresh foods into our program, healthy foods, through recipe development and collaboration with the CIA. We also, one of the great things that we walked away from with this collaboration was we actually developed a tool, an objective tool to help measure food quality. We have a large district, and so quality is real. Quality and consistency, as many of you know, especially in schools when we standardize recipes, it's so important. So it was really great to have that tool that now our own department chefs can go out and assess quality, and we can standardize that across the district. That was very important for us. We also, with this partnership, we were able to implement videos. So anytime we implement a new recipe, we're able to make a video and send that out district-wide. Again, consistency and standardization. And always, we live in survey mode. Even the software that we use for menus, we're constantly in survey mode, because the truth of the matter is, if our students don't like it and they're our customers and they're not eating, we really want to know about it. So the pictures that you see here, when we would conduct our training, we were actually in the kitchen at the CIA. We did small cohorts, as you can see, maybe about 30 managers at a time, just to be able to have that one-on-one and a little bit smaller, more intimate group, if you will. These are actually some of our school recipes that you see. Some of the takeaways from the program that we didn't expect, it was just a great morale booster to get them out of their school kitchens and get them at the CIA just to experience and see something. And I will tell you, we're super proud of the program, but we did even teach the Culinary Institute of America a few things, because the nutrition standards that Jennifer showed at the beginning of the presentation, they were just in awe that all of our meals had to meet those standards. And so, you know, when we put those forward and say, okay, now we have to develop recipes, but this is our guide, it was a little bit of it was a game changer, if you will. So it was just a really great collaboration. What we've been able to take away is we actually have curriculum now that's geared toward these trainings and classes. So anytime we onboard new employees, we make it a point that they receive this training, because it really, really has made a positive impact in our district. The next collaboration that is just so much fun and that we absolutely love is with the CHEF program. And CHEF actually stands for Culinary Health Education for Families. And we have this in our elementary schools across the district. And what it does, it teaches basic nutrition and cooking skills to promote healthier eating habits. And so what that looks like is CHEF actually has a sponsor at every campus. They actually go into the classroom, they do cooking demos, they provide nutrition education, and the kids are actually the chef for the day. So you can see there, that's our little Chef Diego down there. The kids get aprons and chef hats. And so it's just a really neat and cool program. Of course, SAISD is an urban school district. And so, you know, there are different dynamics. And so it was really great, you know, to introduce those type of foods into the classrooms and let the kids actually have fun and create recipes that they can also take home and create at home. So if we go on to the next slide, I can kind of tell you what that looks like for our program. And so, you know, we had so many meetings with CHEF and really just kind of collaborations. And, you know, in our talking with them, we wanted to take it to the next level. And so really what we did here in SAISD was we started aligning the chef recipes that were taking place in the classroom with our own cafeteria offerings. So what that looked like was a curriculum that they would see in the classroom. They'd prepare the recipes. Sometimes they would take it home. And on the days that they did the classroom demonstrations, when they would hit the cafeterias, that food item would be available to them in the cafeteria. Because one of the things that we've learned for our program is we do have that gap in education. And while we do a lot of these programs, you know, and partner with our PTAs and do demonstrations, they really have the capacity to reach so many more students. And so we really wanted to grab onto that, because we've learned that nutrition education is such a part of what we do. And it really, really helped the cause. And the truth is, if the kids, you know, would see it in the classroom and participate in it, they were more likely to taste it once they got into the cafeteria. So just a great, great partnership. These are, that is the chef there from Chef Diego, and that is our chef, Jimmy. So just another great partnership, and we've had a lot of really great results that have come out of the program. Next slide. These were actually, this was actually a slide that they used in their presentation. And these recipes we actually do serve in our cafeterias. That's our tostadas deliciosos, a yogurt parfait, a tomato salad, our snap pea recipe, and that down in the bottom corner is some dill yogurt dip that we serve with veggies. And so again, just really, really great collaboration and partnership. It's been a wonderful experience for our staff. You know, they've been able to see some different ways and really just see the kids participate and interact. So again, just two really great collaborations that have really enhanced our program. You know, it's just nice to have that partnership to be able to expand what we do. We do serve a high level of students that live in poverty. Many times they're not familiar with these types of food items or have never seen them. So it's really been a win-win on the education part as well as the availability. So real proud of that work. And that is all I have. So those are our own little SAISD superheroes that we feed every day. And so we always say we take our jobs very serious because we're growing superheroes. So thanks again for the opportunity, and I'll go ahead and turn it back over to Jennifer.
Thanks so much, Jenny. And I love this picture. I love that you have it in your slides, and it just is so cute and shows, you know, the students really just, they are our little superheroes that we feed every day. And I just really appreciate you sharing with us. So next we have Miss Stacy Sanchez-Hare from Share Our Strength.
Hi, good morning, everyone. As Jennifer said, I'm Stacy Sanchez-Hare. I proudly serve as the director for No Kid Hungry Texas. I am based in San Antonio, and I know Jenny, and I'm going to be visiting because that all looked amazing. And I wanted to also say CIA is just like an incredible resource in our town, in our city as well. So y'all, a little bit about me and my work. So No Kid Hungry is a campaign by Share Our Strength. So Share Our Strength is the national organization that I work for. It's based in DC, but they do work across all 50 states. And the No Kid Hungry campaign is the campaign I oversee in Texas that's dedicated to ending childhood hunger. So just a little bit of kind of overview, because sometimes we say it interchangeably, but just know Share Our Strength is the parent organization of No Kid Hungry. Okay, next, please. So I know I'm preaching to the choir here, y'all, but we love to share this slide when we go out and talk to folks, because I think the thing that we try to stress to people is that hunger is not a scarcity issue, right? You know, I've been a social worker for over 20 years. There's always not enough of, you know, housing, diapers, teachers, classrooms, whatever that thing is. And that's not the case with food. And so we know it takes more than food to fight hunger. And so the places that we really think about where we know kids have access to nutritious meals is school. And so a lot of our grant making efforts, a lot of our advocacy and technical assistance is engaging child nutrition staff and partners. And then we also look at it holistically, right? Like kids are not just hungry at school, although that's a great place to find them and feed them. We also try to help families access food. And so just an example of how we might do that is, for example, at City Square in Dallas, we fund a SNAP navigator, and that person is responsible for going out and identifying families, and not just identifying them, getting them enrolled, getting them application ready is what we would say. And so we want to connect families to sustainable sources of food. So they are not you know, we look at our work a lot as what we call, when we think about our relationship with the food banks, is like shortening the line. And so we do not want folks to, you know, live in crisis and kind of day to day. We want to help them find some sustainable food source. And we already have federal nutrition programs and the infrastructure built to do that. So that is a little bit of how we try to address it. And then in the community, just like today, I will often go out, and I have the privilege of leading a team of 4, including myself, and we are often out throughout the state, going to those meetings, presenting, talking, learning, listening, and thinking about how we are best suited to help. Okay, Jen. So Jen, I heard you say some of these sets too. So again, shouldn't be such a surprise, but in terms of our how we address and ending childhood hunger, grant making is certainly a big bucket of what we do and how we do it. And so in 2022 alone, we invested over 1.8 million across 53 school districts and community groups. So like I said, that tends to be child nutrition departments, community-based organizations, as well as food banks. And so essentially anybody who is interested in increasing access, meal access for kids, we are interested in talking to you. And we have an active grant round that was launched just last week. So I will happy to share information with that afterwards if people are interested in learning a little bit more about that. And then, you know, here we've got some statistics about over 90 million meals provided. And we worked really hard to cultivate our statewide partnerships. We work really closely with TEPSA, TASN, TDA, the Texas Rural Education Association, and other groups across the state to essentially also help not just cultivate those relationships, but connect them. We want to build the connective tissue in our state so people know who the person to go to is for this. Or sometimes I'll hear of someone doing something in West Texas, and I'm like, they're doing the same thing in East Texas. You guys should talk, right? And so there's a lot of convening that we try to do in connecting. And so we do that through our statewide and local partnerships. I will say this number 1 in 6, it used to be 1 in 5. So there has been progress. We are seeing gains, and we still have a lot of work to do. And so the big win. Okay, so you guys, this is my 3rd year in this. I just completed 3 years. Last year, when we were thinking about kind of what we wanted to do and how we wanted to handle it, we made the decision to pursue the elimination of reduced price meals in the last Texas legislative session, which ran through January through May of last winter and spring. So we, and you guys, like I said, I'm a social worker by training. I do not have a lot of experience in advocacy, but we hired a lawyer. We also hired a lobbyist, public relations firm, and we threw everything at including the kitchen sink to see what would stick. And we engaged our partners. We asked our partners to advocate for us. We created toolkits and sent them out. We went to the Texas House and provided testimony. We identified hunger heroes, legislative hunger heroes, and Representatives Tony Rose in North Texas, as well as Representative Armando Wally in Houston, and received some Senate support from Senator Saffarini from Laredo. And so it was a labor of love. It was a ton of work, but it was incredible because what ended up happening was that at the end of the session, we received $6.6 million allocated by the Texas legislature in service of eliminating reduced price breakfasts. So we had asked for breakfast and lunch. We only got breakfast, but we see it as a great foundation to build upon. And our work now is really dedicated to driving breakfast participation. We want to make the case and go back to our legislators in the next session, January 25, to say, hey, this piece of food policy really, we were able to feed 70,000, hopefully more plus kids for breakfast. What could we do if we had lunch, right? Or what could we do if we had something else? And so I look to you all for those ideas to help me think about kind of what are the needs in across the state? How can we best, drive systemic change that affects thousands, tens of thousands of kids across the state? And so this was just like a really big accomplishment and win for us, and obviously for the children of Texas. And so we were absolutely thrilled. And as we said, our work continues. Okay, next. Oh, and that's it. Thank you. Okay, but you guys, that was a lot of information. I went through it kind of quickly, so I'll pause and I guess, Jen, turn it back to you and happy to answer any questions. Sorry, Jen, you're over here. That's why I'm looking.
That's all right. Thank you so much, Stacy, for telling us about that amazing collaboration and advocacy work that you guys did to really have a huge impact on our Texas students. And like you said, this just got passed in the last session. So we will be seeing what the impact will be in the next year. And so hoping to be able to collect that information and see what kind of impact it will have for sure. So now I'll open it up to the questions. I do have a couple questions already written down, but if you have any other questions, please feel free to put them in the chat and we'll go through the list. The first question I have, and this could probably go to, either Lillian or Jenny, either or, but they're asking about local foods and if local foods qualify for free reduced programs. I know the answer, but I want you guys to answer it. So I think they're meeting it. I would say either Jenny or Lillian. It didn't say, but I think either one of you guys could answer. So do local foods qualify for the free and reduced child nutrition programs?
I can take a stab at that. Absolutely. I mean, the only, I guess that they would have to meet would be the meal pattern and make sure that they're compliant with the meal pattern. There is a certain way for vendors to get registered and so forth. I know Lillian does a lot locally, so she can probably answer that at the vendor level. But truthfully, as for our program, the procurement standards, as well as just meeting the nutrition standards, would be acceptable. Lillian probably can speak more to the local qualifying, I guess, on her side.
Well, my computer doesn't want to listen to me. Yeah, so obviously, Jennifer went through kind of what our standards are. So we have to have those 5 components offered every day. So, the more tomatoes, the merrier. They all kind of come from different, the different subgroups on the vegetables and all that sort of thing. The nice thing, in my opinion, of cooking local things and doing more what we call scratch cooking as opposed to already processed foods is we really can control the nutritionals. I find it's a lot easier to meet the sodium and the fat and the calorie restrictions if it's something that we're preparing from fresh here in the district, as opposed to having to work in manufacturers' items into our nutrition analysis. So yes, all of those would probably, like the things I showed you, like the salads and the tomato salads and that sort of thing, those would be additional choices on top of whatever we have menued on those days.
And to just add to that, there is just the procurement piece, like Jenny was referring to and Lillian alluded to as well, that there are certain district level and state level regulations that have to be met to procure food for school menus. And so as long as those meet those requirements, in addition to the nutritional requirements, then local foods would absolutely be on the menu. And like Lillian showed on her slide, she already serves an incredible amount of local foods on her menu. And so I think as a state agency and just in general in Texas, school districts are really striving to include more local Texas products in their schools. And so we're trying to support that in different ways so that it makes it easier for schools to then menu local foods in their school meals. All right, and then the next 2 questions are going to be for Jenny. It's about your chef program. One question was, where does the funding for the chef program come from? And then the second part to that question is, did your ADP, which is average daily participation, increase with the chef program?
So chef was a grant program that San Antonio ISD participated in originally. It was actually spearheaded through the health and PE physical education department. We kind of did the snuck in there, I guess, for lack of better words, but truthfully, it was run out of that program. And really, we were just kind of an addendum to that contract. The chef program is now actually under the umbrella of the food bank here in San Antonio. So there, might be able that, you can reach out and see what they have to offer if interested. They may be able to assist with either some training or recipe development and so forth. But originally, Chef started as a grant in San Antonio ISD, and it has since moved to the food bank. In regards to ADP, we have about a 94% ADP at lunch for our elementary schools. We have a very high participation rate simply because we're CEP and we serve a very high population of free and reduced. So to say that it made a really large impact on ADP, probably not as much as it did just really for awareness and nutrition education. I don't know if that helps answer the question, because we already had a really high participation rate at our elementary level, but I think it really enhanced the education of our students and the awareness of our families, and really just an overall collaboration, even at the school level. The folks that are teaching the students in the classroom, even with our own cafeteria staff. So it really just kind of provided that collaboration at a campus and really just kind of wrapped around, and made that full loop as far as nutrition education, healthy eating, healthy foods, and alignment with the cafeteria. So I think that probably was the biggest benefit.
That's wonderful. And I really love the tie-in because, I've seen school garden programs or other types of culinary programs within schools, but they don't make the connection to school meals. And so I really loved how you guys had that connection there and helping to really bring more students into the cafeteria and seeing the things that they're cooking in the school lunch. So that's wonderful. Let's see. It looks like we have time for a few more questions. If you have one, please put it in the chat box. I also wanted to kind of know from you guys, just as we're going through the presentation, you know, we're sitting here with a lot of parents and PTA and SHAC members and things in those organizations. Is there anything that you can think of that they could do to help enhance or promote school meals and help support, you know, the programs that you guys are doing?
I can talk about that. We have a huge amount of support from our administration. We also do a lot of social media outreach and that sort of thing. So the community is very supportive. I don't know if anybody else got involved with a Milkgate, but you know, even when we have an issue in the child nutrition department, the whole community comes to our defense, you know, so that's a very nice thing to have out there. But I work on our SHAC committee. I stay pretty involved in that, so I get to talk to parents usually at least 4 times a year. But we're a small school too. So, I mean, I run into them in town and I hear great things, you know, I hear what their kids like, what their kids don't like, and get a lot of feedback that way. Our PTA is very supportive. When you're in a small town like this, it's pretty much all the same people running all those different organizations. So I would just say that if you are lucky enough to have administration and you know those school support groups that have your back, then you have almost won the battle for sure. So.
Well, I can go ahead and chime in, and you know, we're not a small town, but I think, you know, people are people, and I think food is something that we all have in common. And you know, I think we all have that cause where we want to make sure our kids are fed. We want to make sure that they're healthy. You know, we know that a lot of our children here in San Antonio ISD are food insecure. Many of them live in food deserts. So we realize the resource that we offer and really, really use that to their benefit. I mean, what a power, right? To be able to provide these meals to all of our students and say, you can have breakfast, you can have lunch, and you know what? Have supper before you go home. We do Eat Now, Save It for Later campaigns. That way, if a student doesn't consume an item, say, for example, a banana or something, they can put it in their backpack and take it home. So I think if I could say anything is we need to know the communities and the populations that we serve. So we know what type of initiatives and what type of programs would be helpful. But as far as, you know, getting a message out, I would just encourage communities and other districts, use your child nutrition program as a resource. Let us be a tool. You know, we like to get invited to PTA meetings and PTO meetings. We sit on the SHAC as well. We want to be part of that, and we really do have a lot of really cool and awesome resources that we can provide. Last week, for example, we held a huge culinary expo for our high school students. We invited 150 of our high school students to come in and taste test and sample in preparation for next year's menus. And when you have a teenage boy say, this is the best field trip I've ever been on, you're like, this is great, you know. But let us have some fun, use this as a resource, and we are certainly here to help and support schools and communities, you know, for the best of all of our students.
And Jen, I'll just pipe in and say I'm also a parent. I have a first grader at our local school, and before I started doing this work, I just did not understand how child nutrition departments run. I didn't understand all they have to do to stay afloat. I didn't understand it's basically like a small business, and like the things that we asked them to make lemons out of lemon, or we asked them to make lemonade out of lemons every single day. And the fact that they do it by scratch cooking, by resourcing natural. Anyway, what I'm trying to say, y'all, is like, go out there and tell your friends. tell your family members. Like, I really see a lot of my work as like educating folks on what child nutrition departments actually do, how hot, right? You know, and I think also challenging the stereotype of like lunch ladies, and it's, you know, whatever the connotation is of that, positive or negative, but it's like your child nutrition staff are professionals. They work incredibly hard. These are people who did not go home during the pandemic, right? Like, go in, volunteer your time. I go in and I volunteer in a kitchen at least once quarterly, just to like stay proximate to the work and remind myself how hard it is, how physical it is, and how much people do every single day to provide for our children. So also use it, be yourself as ambassadors and talk to folks about it and the importance of school meals. And also, I'm always telling people to fill out their free and reduced form, but also just that, like, your child eating meals is good for your community, right? In so many ways. And so I also see myself as just an ambassador about school meals now, and talking to folks about that and sort of changing hearts and minds and getting people invested, involved in eating school meals. So that is a part of something I see as a role we play in influencing.
Thank you so much for all of you for adding those comments. And Stacy, I feel like you just wrapped up everything I was thinking. And that, that was like, oh my gosh, she's so on point. That's exactly what I was thinking as well. And, I really encourage you to, if you have school students, in schools, to go have lunch with your child, go see firsthand what it really looks like. Go, call up your child nutrition director. You can find that through your school website usually. I really encourage you to get to experience and see, how school meals are affecting our students every day in such a positive way. And so with that, I think we're just about with our conclusion of our time. But I just want to again thank our panelists so much, each and every one of you, for all of the effort and dedication and just heart that you have for school meals and all the things that you do. I just really appreciate it. And I know that our students across Texas are benefiting from your work. And so thank you all so much. And I will turn it over to Michelle.
Thank you, Jennifer, and thank all of you. Y'all did a great job, child nutrition directors and people that work in school meals are underappreciated, and they play such an important role. It's just like when we talked yesterday about our physical educators are really social, emotional health leaders. Our child nutrition people, our cafeteria managers, smiling at a kid and being nice with their walking through the line, those things make a huge difference in how a child, his day goes. I mean, I'm old school. When I grew up, we knew all the lunch ladies. I mean, they were part of our family and they looked out for you. And my brother always got extra servings because he was the football player. And, it was, we had hamburgers on homemade buns on Thursdays. And at the time I wasn't very appreciative. It's like, oh, I want a real bun. I don't want this homemade bread. And now I look back and go, oh my, what was I thinking? But anyway, I digress. It's really nice to see so much emphasis and focus. And we were really happy to be partnering with USDA to help our small and rural, communities do scratch cooking and really elevate what they're doing and use local produce and local vegetables and milk. We got to get that milk in there. So thank y'all. It's such important work, and we appreciate everything you do, and you matter so much to the health of our children. So we will appreciate you, Jennifer, for putting this great panel together, and the Department of Agriculture for all the support they've given us over the years. So we will be visiting with you again, I'm sure, as we move forward. And I'm glad to know that Florence was one of our recipients. I'm going to touch base with you soon about that, see if we can't partner on some other things.
Thank you so much for that. You have no idea how helpful that is to our little bitty district up here.
Well, it's exciting. I'm excited for y'all. All right. Well, we have one more session, but we're going to give everybody a break because I definitely have to get something going myself here. to wrap this up, but we are going to have all of our moderators returning to talk about their perspective on their sessions. And so if you missed yesterday, it's your chance to hear a little bit about that. Or if you came in late today, this is going to give you an opportunity to find out a little bit about what was shared. It's like Alice said earlier, I learned something new. I've been doing this for 20 years, and every time we do one of these, I learn new things, and I've learned something from every session. So stay tuned for that discussion. We'd also like to hear from you as people who attended these sessions, what your thoughts were and where you think we should be going next. But before that, we're going to give everybody a break, and we're going to let Chad give us a little physical activity, and then we'll see everyone back after that at 11:20. So Chad, take it away.
Awesome. Thank you, Michelle. Good morning, everybody. My name is Chad Miser, and I'm with the Catch Global Foundation. I'm with you virtually from Round Rock, Texas today, seeing all that food and all that's going on in Florence. Might just have to drive up the highway for lunch today. So if you're not familiar with Catch, go to catch.org. Learn a little bit about us, or if you are familiar, but it's been a while, it's a great resource. The website's been updated. You can go there and learn how we are supporting and creating healthy environments, not only throughout Texas, but throughout the world now. We're in multiple countries. So my job today is just to do a little brain break with you. We're big believers in environment influences behavior. And from what I've been listening to this morning, you're already doing great things, whether it's PTA side or food service side, supporting and creating healthy environments for kids that maybe otherwise wouldn't have those resources. So I kind of want to reciprocate that and inspire and influence an environment that kind of help you refocus in the last hour that you have with Michelle and team today. So I got a little brain break for you. I just call this game number 6. When I say go, if you're interested, I would love to see your faces and watch your frustration or your celebration. So if you want to turn your camera on, that will be great. If you want to stay muted and off camera, that's fine too. But when I say go, you need to stand up and give yourself a little bit of room, and maybe a chair or a desk or somewhere where you can balance, because you will be standing on one foot. Ready? Go. So use the back of a chair or something to balance if you need it. And we're going to do this activity in a couple of phases, okay? Hopefully Karen's there. I don't even know if Karen and I have done a lot of catch trainings together. I don't know if she's seen this game or not. When I say go, you're going to take your right leg, lift it up off the ground, and just start rotating it in a clockwise circle. Not really large circles, but not super small either. Kind of mid-sized circles, right? We're just kind of rotating that hip. We're balancing. We're not falling over. You're not going to stop doing that, okay? Keep doing that. But really important, when I say go, you're going to take your right index finger on the same side. Your right foot is going in clockwise formation. I see you really focusing, Jennifer. I like this. Clockwise formation. When I say go, you're going to take your right index finger and you're going to draw the number 6 in the air, starting from the top down. When you do that, your foot's going to change directions. Go. Anybody getting it? Is your foot decide to go counterclockwise when you... Most people that can do this, that can keep their foot rotating in a clockwise rotation, can also play instruments. I cannot play instruments and I can't do this. Andrea, I see you. You can play instruments. You got this down. Now, if you try this, if you go across your midline and you do your left leg and your right finger, or vice versa, your left finger and right leg, many of you can do it. So I gave you something to fidget with the rest of the hour that you're sitting at your desk. Y'all are going to be sitting here at your desk listening, trying to figure this out. But I want to make a quick kind of analogy to yesterday. We talked a lot about mental health and mental wellness, and this is a really good example of sometimes the environment influences behavior. Even ourselves, we can't control our own behavior, our own actions. So our brain is telling our body to do something, and we can't even control that. So as educators and policymakers and folks that want kids to live healthier lifestyles, we have to do our job to cultivate that environment for the kids and give them opportunities to be exposed to those good things that'll make them healthier and feeling better and be better students and better learners. So I call that game number 6. Hopefully you had fun with it. Some of you can do it. Some of you will just be fidgeting for the rest of the day so you can figure it out. So thanks, Michelle. You're muted, Michelle.
I was going to say, I failed yesterday at my estimation of how many steps it took me to get to my kitchen and back. Now today I can't draw a 6 with my right finger. You've got to come up with something I can do here.
I can make that work too. I can find you a win. Well, at least you're smiling and laughing, so that's a win for me.
It's fun. It's fun. Thank you so much for sharing your time and your activities breaks with us. It's always fun to find new ones. So
You're welcome. Thanks for having me.
I can challenge other people. All right, y'all have a great break here, and we'll see you back in about 10 minutes. Ah.
Hello?
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 Yes?
Can I help you?
I'm sorry, who's talking? afternoon, or it's not afternoon yet, is it? Good morning. How are you? Get started in about 2 minutes. Okay, Alice, can you join us? And Karen. And I'm afraid we're going to be missing our mental health person.
Oh,
I know. I'm sad because that was a big component.
yeah. Okay, Michelle, can you see and hear me?
Yes. Yes.
Okay, sorry. I was having a little technical issue there.
So I don't think we need this slide. I think I'd rather have our lovely faces. Thank you all for coming back for this last session. I think it's an important one. I think we need to connect the dots. Alice did a great job of starting us off yesterday morning with the whole child concept, and we touched on all the different areas that we plan to bring forward in more in-depth conversations throughout the last 2 days, which I think we did. And now what I'd really like to do is to get first each one of you to share your perspective on your session and a little bit about where you think we should be going or what we should be looking to do moving forward. There's a lot of things we can do, and then there's a lot of things that are a little more challenging. But we need to identify them, identify what steps need to be taken. Is it work with SHACs? Is it work with state level policies? Is it doing a better job of collaborating with our community members, engaging our youth more effectively. What is it that you saw after your session and all sessions that you think we need to look at to guide us moving forward? So I'll just start with our first session, and Alice,
Sure.
you kind of kick it off.
Okay, Michelle, I want to say yes and yes and yes and yes. uh, your comments, your opening, are where I was really pleased and excited to see from the panel that we had. First off, I appreciated having all of the different perspectives and views all coming together, focused on the student health and the school health and the whole child component, whether it's from a teacher to a district administrator, to a school nurse, to a community person, to a shack leader. I think that we're all more effective when we can all get on the same page and cross promote and cross educate. And so what really came as I jotted down some thoughts, what I really thought was strong about the session yesterday and appreciated was the very hands-on ideas and suggestions that came from so much of the panelists, that they gave real concrete ideas. And I think that moving forward, we want to continue to be innovative. And one of our presenters, I think it was Amanda yesterday, kept talking about some of the innovative strategies that they were doing in their school districts to get the very targeted messaging out. I loved the idea of the shack hosting tailgate parties before a school event, whether, because I could see that. I'm in a very small school district. We've got 150 kids total. We don't have a football team, so we're not going to do tailgating for that. However, I could see us doing tailgating before our basketball game, because we have enough kids for a basketball game, a team, or enough kids to do, when we have a volleyball game going on. It could be a great way to get, because we know the community's already coming there. Small school districts, that's one thing about it. They do have a lot of community pride and support. And so how do we get and utilize some of those existing activities and get the messaging out and encourage more people to learn about what shacks are doing, what the school district is doing related to health and wellness, so that we can identify more of those parents and community leaders and just community members in general who might want to hop on board and support some of our initiatives.
That's a good perspective, Alice. I appreciate that. I think you kind of covered everybody, and it's nice to see that things that were discussed are as relevant for a small rural district as they are for a large district. The applications are there, and it's important that we try to move those things forward. Tracy's not here. Does anybody have any comments they want to share on the mental health student and staff workshop? If not, we'll circle back and see if some of our participants have something they might want to add.
Excuse me, Michelle. I was just going to say, I really enjoyed hearing the different ways that districts are doing it, whether it's with through their human resources, EAP, and, just a variety of different ways to encourage that staff wellness. And, again, I can't remember which presenter it was, but, when she was a mentor and would go and ask the teachers, how are you doing? How are you really doing? Right. So I think, we were very cognizant of that, right, post-COVID. And maybe we're kind of thinking we're back to just smooth sailing, but I still think a lot of these teachers need those touch points, and they are still super stressed. And so not just the mental health, obviously, for the students, but for the teachers as well. So I just thought that was an interesting part of that session, to really hone in on, what are we doing also for our teachers, because there is so much focus on the mental health and wellness for our students.
And if the teacher's not feeling healthy, it's very challenging for them to help our kids. So we definitely have to focus on teacher staff health. Thanks, Karen. All right. How about Keith? Would you like to share?
Good morning. Thanks, Michelle. Hi, everybody. Good to see all of you and good to be with you. We had a great session. I'm always excited about talking about physical activity and physical education. And I think the takeaways really are that, the fight is not over. I mean, despite the overwhelming research that tells us how important physical activity is to academic gains, to overall wellness, it still is a struggle. The struggle is real. So whether that be through policy development, through advocacy work, we still need to continue to advocate for physical activity embedded within our school day and embedded within our professional lives. It was not brought up, but at the conversation yesterday, but I think it's important to mention that there's growing awareness and interest in how technology plays a role in our life, and not surprisingly, it's not good, and mitigating technology's impact on our lives. The obvious answer is to increase time outdoors and physical activity. So we need to make those little steps in life be the norm. And then I think the big takeaway was that the great work that is happening within physical education is really because of the individuals that are delivering strong programming. So what needs to happen is we need to celebrate and really lift up those strong examples of what quality programming looks like, and not accept that that great programs can and should exist everywhere across the state. When we think about physical education, there's a reason why it's parodied on almost every sitcom that has been out since the 1950s, and all of us probably, the shared experience that all of us have, and it often makes us feel like we're experts in the field of public education because all of us have been touched by education in some way. But every one of us has experienced probably a negative environment with physical education, and that shouldn't be okay. What should be the expectation is that quality programming should be happening everywhere, and maybe it's not unique, to this industry, but it feels unique to me sometimes in that I get to observe and participate with some of the best educators and some that I feel like provide the most challenge to the field in physical education. And so it's that extreme difference between quality programming and pretty poor programming that I think is the Achilles heel of physical education. So I think there's two distinct conversations, one on physical activity, one on physical education. They do share some ground, but I think there are two things. So I think quality physical education falls on the back of those instructors, And then I think physical activity needs to be embedded within all of our lives, and we need to strive to make that the norm. So that's a takeaway that I had from our conversation.
Yeah, I agree with you. What are we going to do to make that happen? That's where we're striving. I mean, 20 years ago, Dr. Satcher said we can make a difference if we can get into schools and focus on physical activity and focus on nutrition. And I think for a long time we were effective, but then things like the pandemic or hit us and we're 5 steps back. So we need to be consciously thinking about how we move that marble forward.
Right. Well, and I don't know if that was a rhetorical question or a real one, but I'm going to answer it for a minute. So cut me off in a second. But I think you're right, and I think that something happened. I think that when the pandemic hit, I think initially we had I think a lot of really positive things actually happened right off the bat, and I think that there was promotion of outdoor time. I think that there was a little more normalization of work to life ratio, but I think on the tail end of that, we've actually come full circle, and now we've gotten to a place where we're going to really have to remind ourselves again how we do that. And so I think when your question of how do we do that, well, I think we get back to the tried and true things of this is one way is through school board policy. And so that means that every school district should address a recess policy, and the shacks should be pushing for that to happen. If nothing else, that generates a conversation. Now, board policy, sometimes is only as good as the efforts of the administration to make sure that there's adherence to that policy. But it's a start, and it starts the conversation. So I urge every school district to dig deep into your policy and see if a recess policy exists. And I think most are going to find that it doesn't. And so that's a real easy thing to do. I'd be happy to walk you through what we have done in Seguin ISD. We do have a board adopted recess policy. Some school districts have it in regulation, but not in policy. And I would push to have it in policy everywhere. And so I'd be happy to talk to anyone about that if you're interested. Then what usually triggers then is a board resolution is a part of that, and that's going to get some press. And so that I think is a good thing to do. But then I think on top of that, I think all of us within our individual roles need to be promoting the data that supports the need to get away from our computers every once in a while. And whether that's kiddos that we're keeping away from screens at a young age, or those of us that are adults, we need to be sharing that information, because what is going to happen, I believe, is that in 10 or 15 years, there is going to be a huge awareness of how significant our health has been changed because of our technology use. And so, there's a podcast that I just listened to this weekend that NPR was promoting that was highlighting this, and their advice was that 5 minutes of every 30 minutes should be up and moving around. And so that's a super easy thing to do, So how do we all make that happen? Just 5 minutes of every 30, we're getting away from the computer for a second. And so I think that needs to happen. So there's 2 things I think that can happen. One that's kind of more on the individual level, and 2 on the system level. So.
Thank you. Perfect. Anybody have anything they want to chime in with out in the gallery?
I would just like to add, you're exactly right on the programming. And if there was some way everybody could share best practices that, doing things that are working great. I've had the pleasure of working with Jackie Caber in Pasadena for about the last 10 or 12 years. And, you know, she's extremely creative, and she does go to the classroom. She actually writes curriculum for the teachers that incorporates physical activity and different things like that. So, I mean, you know, sharing best practices, I think, is a really good way to bring, you know, new ideas to different districts. I know back when we were doing our research with Baylor, back then the prediction was that by the year 2040, every adult in America would be obese if we didn't change our habits. That was the, you know, the way we were going. So, you know, like you said, it's important for not only the school children, but adults too. You know, you've got to take that break. I know a lot of the large companies, every 20 minutes, they'll ring a bell and they have to stay away from their computer, do some stretches, move their neck, and then they can go back, you know, just to try to help, you know, computer fatigue. So there's a lot of things that a lot of people can do to help with that situation.
Good point, Sandy. All right, well, since you're talking, we're going to turn it over to you, and you can share a little bit about your perspective on the youth panel.
Okay, well, I was very impressed with all of our youth, and I think it was really good that we had, I know my two students go to private schools. We had a homeschooled and we had a public school. So we got, you know, a varied, broad perspective on school meals and how they're different in each area. With our team board, you know, we have 19 members. It's a very diverse ethnic group all over Houston. We don't have any homeschool, but we do have, you know, public and private schools. And, you know, these kids are smart. They come up with all kinds of ideas. They're very involved in their communities. They do community service. They go back to their elementary schools and mentor, you know, the younger children about the importance of living a healthy lifestyle. And I think their answers yesterday were really good. I think they're, you know, like we said, they are our future leaders. And I know our group, and I think the kids that we had yesterday, they're very concerned about being healthy, eating right, getting the physical activity, and, you know, living a healthy lifestyle. And I think that's very important as we go forward with, you know, our youth.
I think it's very impressive. A lot of things kids are talked about, and their lack of involvement, or their lack of, or they're too busy worrying about grades or other things. And when we meet youth like the ones that were with us yesterday, who are devoting a part of their time to helping others be healthy, and they're focused on, you know, themselves and how their health matters. It's important, and getting that perspective out to more youth, I think, is really important.
And they're concerned about their peers' health also.
Yeah.
You know, like Andrew said, you know, the friend that didn't want to eat in public, you know, hey, it's okay, you can eat, you know, come eat with me, or you can do this, you can do that. So, you know, kids are going to listen to kids. They don't want us adults harping on them about, you know, you need to eat healthy, you can't eat this, you have to eat that, you know, you need to go outside, you need to exercise. I think most of the kids nowadays, at least the high school, this is very important to them. And I think it's part of their, you know, their daily routine.
I'm sorry, I missed the comment in the chat when Pete was talking, and I have a quick question for you, Pete. Wasn't there a cap on class size? Did that get taken out? Because there used to be a cap for class sizes of 20 to 30 students, and you had to have a exemption to be able to not have that.
Yeah, they're 45-1 is the
Is that it?
ratio I'm aware of. And then but the best practice is to keep the numbers in line with what a classroom environment would be. And then with that's then as I think there's a lot to that conversation, and again, the best way to handle that is through local policy.
Yeah.
Because we're not going to be able to get a state policy that supports everyone the right way. And I think about some of these big school districts that have to, if you're running 1,200 kids at an elementary school, what you're going to have is 2 gyms to be able to run that many kids through that specials rotation. So it's hard to say one size fits all, and some of these gyms are really, really big and they have multiple PE teachers. And, I have many thoughts on that as well. But
Okay.
I think the bottom line is that there's a fine line between quality programming and the environment that is created to support that quality programming. So you can have the best teachers in the world, and without the right equipment and without the right environment, it's not going to be a safe situation. So that's where, again, it's all about advocacy. It's about those teachers that are in that situation. They're the experts in that environment, what they need. And so I think what you do is that's where the separation of physical education and physical activity come in play. So we need daily physical activity. If you cannot create the environment for physical education to be conducive to learning, then how do you offset the school day to have physical education happening in the right sequence, and then have physical activity happening in addition to that? So what I'm trying to say there is that I believe that unstructured outdoor recess breaks can provide some of the physical activity time, and that takes some of the pressure off of physical education to not only provide the physical activity and the skill development opportunity, but you can really focus in the physical education time to be really about skill development, about teaching some of those social skills that are so important.
Good point. Thank you. Okay, Karen, let's talk a little bit about the parent perspective.
As I was like jotting down some notes for what was just being said.
I know.
Yeah, so I think, I really like the perspective of both Sarah and Melinda. Like I said, I've known Melinda for a while, to provide that secondary experience. And I was talking with Sarah yesterday in preparation for this, and she's a little bit new, and I think she's coming at it from looking at a different lens, because she's, mental health and research is her background, but newer to PTA, newer to SHAC. And her insight was, we have all these resources for secondary, right? Like, I wish we had more for elementary. And then, I hear on the flip side, sometimes, people say Texas PTA has so many resources for elementary, but not enough for secondary. So I think it looks very different at both levels. So I had just, followed up with an email to both of them afterwards, thanking them. And both of them were very complimentary, because they had not talked with each other yet. Just what they're doing on both flip sides of the secondary and elementary, and it looks very different. And so I also appreciated the way Sarah sharing, again, because we are in the same district, and I this is the power of the ask that we always talk about in PTA and with parent volunteers. She's been serving on the SHAC. I'm radar on as SHAC co-chair, and knowing that I would be rolling off this year, trying to figure, who would be a good fit for this, who would want to do this, but not just the want to, but who would be a good fit, in my opinion, because we have been making some traction. And originally, when she told me she was taking on the PTA president role for her school, I actually told her not to do this, like, don't take on SHAC co-chair. And then when we kept talking and realized that her first year of presidency would be this year, so she could kind of mentor under me and learn the ropes, and then I would still be there to help her next year when she takes on, and she'd be in her second year of presidency for the PTA. So it kind of worked out. But I feel like what they said is so true, and I'm kind of hitting that point a little bit, is that volunteer burnout. you rely on these parents so much, and, parents that work part-time, parents that work full-time, and it's a lot, but we truly, I know it makes a difference in my own school. I know it makes it a difference, in the district and in districts that have that involvement, whether it's a PTO or a PTA. So I think it comes back to the ones that don't have that involvement. How can we help them if they don't have parents like Melinda or Sarah on their PTA with a passion for health and wellness? How do we reach those other parents where that's the last thing on their radar? They're going to get these newsletters that go in the trash. Health is, it's not their priority. So how do we find those different avenues to reach them, and not just in low income schools to higher performing PTAs? You still have parents who might have a higher education, and health is not their priority, so they don't care either. And not that they don't care, but and there was one more thing I was going to say about, and just the sharing of the shack perspective, because I think yesterday we heard such wonderful examples from Fort Bend and Goose Creek. I mean, I'm writing notes constantly, getting motivated by the great stuff they're doing. And again, I know Northeast has had a great shack as well, but as Sarah was pointing out, Richardson is kind of rebuilding still a little bit with our parent, and we're slowly but surely getting there. So I'm hoping for the participants that are still on the call that we were able to, give some motivation that, yes, there are some amazing districts out there doing things, but don't give up, even for the ones that don't have a super involved shack, super large numbers. We can speak from experience that it slowly builds, and you can still make a difference, whether you have a big district, small district, super involved shack, not super involved, and the PTAs as well. So I think, again, you don't have that healthy lifestyles chair. Like Sarah said, they kind of, molded under their programs chair. So ways to be creative to keep integrating health into what we're already doing, and helping to connect the dots and bridge that gap between family engagement and what the school district is doing.
I remember when several years ago we had a project in middle schools, and it was such an eye-opener for me to see, when I got to middle school, we had great involved parents. We had PTA. We built a sand pit and all these different things, and everybody got on board. And then I got to middle school and I went to my first PTA meeting, and it was me and the president. And it's like, where are all the parents?
Where'd they go?
And it's exactly what you're saying. It was volunteer burnout. I mean, we worked them to death in elementary school, and they got to middle school and they thought, oh, my kids don't want me here anyway. And they just disappeared.
And that's when we actually probably need them more.
Exactly. And that is when we need the parents to be involved. And the kids really want them, even though they sit there and go, oh, no, I don't want you at school. Don't do this. But
I still remember even a parent saying, and this was either at a middle school or a high school, and their PTA gave out free hugs in the morning. And again, you would think people would shy away from this, but some of the kids loved it. They're not getting that hug from their parent in the morning, and they truly did want it at a high school level, right? So
yeah. But we've got to find ways to reach out. And some of the parents in middle school just said nobody asked. So it's that ask thing again. If you ask somebody, what do you think you can do? And they're like, well, I don't know. And then you find out that they love gardening. And the next thing you know, we have school gardens. Or we set something up because the dads like to show kids how to do tricks with basketballs. And next thing you know, they're coming to lunch and doing. So there's ways to engage those middle school and secondary parents, if you tap into them and make sure they understand how important it is, whether you have a PTA or not.
Yeah,
you can have a parent group, but anyway. So
and
yeah,
I think Melinda kind of echoed yesterday's voice on this, student involvement, and motivating our students to be those change agents. When she's utilizing those students for her driver safety courses, you're empowering them. The kids are going to listen to other kids at that peer mentoring. So I think that's critical at all levels, elementary through high school. Sarah also, when I was sharing again some of the great strategies yesterday, shared from Goose Creek and Fort Bend, when we talked about Texas Shack Network. So I know when you started this session, you're like, things that we can do, maybe can't do. And I know we've started this, and I know it's got some great resources on there. So if that's maybe one takeaway or one step forward that we go as a steering committee, is really, continuing to grow that, and being able to connect other parent co-chairs from around the state so they can share those ideas more frequently. I don't know what that looks like, but that would be one of my takeaways.
Thanks. So we have a question here, and I'm not sure, I'm assuming that TDA would be the Department of Agriculture. And how do we get TDA and TEA to harmonize? And that's a very interesting question. We'll let Jennifer talk a little bit, and I'm gonna contemplate that, because we had a little bit of an issue with policy this past session with a legislator wanting to move child nutrition to TEA out from under the Department of Agriculture, and we jumped in and fought against that, and it didn't happen, because it just makes sense to have it under the Department of Ag. But how we bring harmony to those two, that's interesting. So Jennifer, share a little bit about your session.
Sure. Well, first, start off by answering the question about the session, and we just had our session, so I'm still letting everything sink in, and thinking about all the presenters and the comments that we had. And I think one of the big key takeaways was that it takes a village, it takes collaboration to be able to enhance and promote school meals, and ultimately to get more students eating school meals and benefiting from the nutrition and benefiting from the school meals. And so it was great to hear from our panelists of the creative ways they're doing that, whether it be through working with us to collaborate for recipe development and getting funds to be able to, create new recipes and have trainings for staff, things of that nature. Also, working with, through USDA funds and grant opportunities to be able to, enhance things like, for instance, Lillian was talking about the Healthy Meals Incentive grant she got, which will be going towards equipment for her school district. So looking at these different ways to really help out school districts and child nutrition programs to make the highest quality and most nutritious meals for students. Because as a dietitian, I always say it's not healthy if they don't eat it. So, helping students to, meet that need, but doing it in a way that's going to be culturally relevant to the school district that they're serving. And so I think we, really try to showcase that with the different creative ways that were shared. Though I will say it was just a small, tiny little snippet of what these school districts do on a daily basis, on an annual basis, and all the projects and grants and programs that they're incorporating into, the giant book of regulation that they have to follow for these child nutrition programs. So I hope that we were able to, in the short time, try to educate, people in the virtual summit today and bring some awareness, and just give you a little bit of a taste so that, you can go back to your school district and talk to the child nutrition director. They're happy to answer questions. Some of them even have parent advisory committees similar to the Shack, where they try to take feedback from parents and even student involvement as well, to try to get that feedback, and have a better way to communicate with the community that they're serving. So I think that those were definitely some things that we try to give takeaways, or things you could do, or, go eat lunch with your child. If you're trying to find out about the school nutrition at your child's school district, that's the fastest and easiest way, go have lunch. And then, ask, oh, is this carrot you're serving, is that a local food? Or, ask them about the nutrition, if you're having questions. I feel like that's a really easy gateway, and the staff there and the directors are there to be supportive because they want you to be aware of what's going on so that you can also then be an advocate for school nutrition. So I thought it was a great session, and hopefully got some brains turning and thinking about things, and wanting to learn more and be supportive for the school nutrition programs in their areas. In regards to the question about trying to harmonize TDA and TEA, like you mentioned, Michelle, there was some legislation going on about that. And so I don't really want to comment beyond that, but I will say in terms of harmonization, I see the question in a way looking at, how do we communicate the programs and talk with school administrators and different people within the school community? Because where I see a gap sometimes is even teachers who are walking their students into the cafeteria don't know what is required for school meals, or don't know how to communicate those things to students. And so how do we bridge that gap? Or with principals and superintendents, some of these programs, really require the support of the principals, of the superintendents, in order to advance and enhance those school meal programs. So how do we make those connections together to really help communicate those things so that, we're all on the same page and working together towards the same goal?
That was very well put. I mean, that is where there's a disconnect. And the thing that I've learned over the years is that parents just don't know. It's not, when we've done things where we invited parents to come in and do taste testing, it's like, oh, this isn't what I expected it to be. And
it's not the school lunch you grew up with.
Yeah. It's the same thing as they run into in physical education. It's like, like was mentioned yesterday, you have an administrator who had a terrible experience in physical education. I didn't have the greatest time. I could never do a chin up and all the things that were required, but I don't view our current programs that way because I've been involved with them. A lot of times it's just lack of knowledge. So we've got to do a better job of educating our administrators, especially our principals, because they run the kingdoms. You can have a policy at the district level, but if the principal's not on board with it, it's not going to happen. When we passed a recess policy in Austin, we went to the principals and talked to them about it and made them understand why it was important and essential, and then got the teachers union behind us, and they agreed that it was important. And so when the policy was passed, everybody was on board to make it happen. But you can't just come in and unilaterally have a policy on something and then expect everybody's going to implement it. Same thing with school meals.
Absolutely.
Yeah.
I mean, a great example of that would be breakfast. We just passed this legislation to offer at no cost breakfast school meals to students who previously were in the reduced price qualification. And so we're increasing access to free school breakfast meals, but a lot of the service styles and options for serving that breakfast, they're seeing such great participation when it's an alternative setting. For instance, breakfast in the classroom, or breakfast after the bell, or grab and go breakfast. And those types of service have to go through the principal and also have buy-in from the teachers. We realize that doing breakfast in the classroom can be challenging at times, but trying to work together with those school administrators and with the school staff to get the buy-in and figure out the ins and outs so that we can serve those students in a way that's going to be impactful for their day, but not put too much burden on the school staff.
Lena put a comment in, and you're absolutely right, Lena. We're running into a lot of issues where the principals have cut or changed their schedules, and now you've got a 3,000 student school that has one lunch period, and there's no way that you can get all the students through there. So you end up with an open campus, and the students leave, and and the meal program is, diminished. So those principals have not been sold on the importance of those school meals and how healthy they are and what that does for their kids. So I think the thing I'm taking away from today's conversation is we've got to get to the school administrators.
Right.
To do a better job of educating them.
And I would just suggest, if that's a situation they're experiencing, to, try to have that administrator, that principal come to the cafeteria during lunch. Show them. I feel like visualization and seeing what's going on can be really impactful when it comes to that. And, really have them come to lunch, for the day, and let them have their lunch in, 15 or 20 minutes. Like, let them experience that, because that may help them kind of better see, where you're coming from, to try to, help come to a solution.
Well, and also have them check their numbers. If it's a high school and you're having that situation, a lot of the kids leave campus, how many of them are staying gone? How many of them are not coming back after lunch? How many of your, there's different numbers that you can look at as well. So those are the kind of things that you definitely need to pay attention to.
Food waste is one too, with the shorter lunch periods. There's been food waste studies done in the past at schools. So, that's another option too.
Anybody have any extra comments they want to, that have come to mind as we've talked through these different sessions that you'd like to share? And those of you who are still with us, feel free to turn on your video, open your mic, and join the conversation. Give us your thoughts, your examples of how things have worked, or other issues that you think we should be looking at.
Thank you,
Jenny?
Michelle. Go ahead, Sandy.
Now, I was just going to ask, do many of the schools, have share tables?
I know that there are schools that do have share tables. It usually is something that they also have to establish within the district. It's not a requirement. It's not something that we promote necessarily, but as long as they're following guidance on their district level and food safety regulations and whatnot, then we've seen schools do that.
Okay.
We at Smithville ISD do that, and very successfully, but we had our health inspector write us up a protocol for that. And matter of fact, I have kids who come and ask for extra milk because there's none left on the share table. So yes, it's very successful in our school district.
I know in a lot of the Title I schools in Fort Bend, it's very popular too. If they can put that banana or apple in their backpack and take it home, at least they have something to eat when they get home. And maybe that's their dinner. So.
Okay, Gabriella.
Michelle.
Yes, ma'am.
This is Candy Bealey at Smithville ISD. I just want to tell you, I remember attending these events in person before COVID, how much I would leave with the knowledge of so many things. And I really appreciate this. This has been great. These 2 days, I've learned a lot, and it helps not only because of doing child nutrition, but listening to the others and the other subjects that I really appreciate the variety of subjects, because it helps us to understand what else is going on as well. We kind of all get within our world, and we don't really know what else is going on in the district or in different programs. So thank you very much for this again. And I've enjoyed these 2 days immensely. So thank you.
That means a lot coming from you, Candy. Thank you.
Okay. Thank you, everybody. So I will echo everything that has been said. Something came to my mind as we were talking about working with school administrators. I speak with principals and assistant principals frequently as part of my job at RMC Health, managing the Second Chance program, which is an online alternative to suspension program for youth that are violating tobacco policy on school grounds. from those conversations, I can hear the frustration, I can hear the angst of, wanting to do the best they can, and then they have to deal with the day-to-day behavioral response, a lot of the violence that is happening in schools. So just to share that a bit as we keep in mind, I think it feels almost like our teachers are maxed out, our administrators are maxed out, they're at capacity. They're barely surviving in their schools with lack of funding, lack of capacity, lack of resources, and just to keep that in mind. And then one other comment going back to at least Alice. You had mentioned the idea of making sure we're reaching out to parents and families. And for me, it is important to raise the question of, do we have enough representation across families and parents that are of color? Not only when we're working with youth and students, but also with families and parents. And one of the challenges that I have learned in my years of being involved in the education system is that parents really want to get involved. Parents really want to help out, and they want to be those volunteers. And yet they need some support in terms of training. So can we think about offering additional leadership training for these leaders, community parents who really want to help out? They want to do it all, and yet they may just need a little bit of support in terms of, how do I become a civic leader in my community? How do I engage in all of these committees? And the readiness piece is missing, because we do need to offer additional support, at least in my experience. And I would throw that we do have some initiatives that are wanting to offer this leadership training. The Family Leadership Training Institute, which is a national initiative out of the Parent Leadership Training Institute. I think it's North Carolina, and it is implemented across the US. And they do have alumni that can, partner with SHACs, partner with PTA, so that the voices become more representative. And also there's the volume, right? Like the numbers that we need to be able to create change, especially when it comes to policy. Those are my 2 cents. Thank you.
No, yeah, thank you. And certainly that was a good comment, Gabriella. I think that one of the really poignant pieces that came out of yesterday's discussion as well really had to do with that discussion around action items, and with parents and SHAC leaders and parents who are attending SHAC meetings and other events, to feel that they're walking away with a something concrete to do, whether that is that they sign up to help be a lunch leader for the class, on a particular day or a week. And so I can certainly see that, there are opportunities across the board for all groups to always hone in on what people can do. We've actually had this conversation, Michelle and I, in El Paso at a training that we were doing together a couple of months back with some of their school districts. It came down to the fact that everybody wants to feel that when they are attending a meeting, it's especially something that's very local, very personal, with their family, with their kids, that they weren't just there to listen to all the people standing up and giving the reports. It's not about just coming and hearing reports. It's about ensuring that people are empowered and feel that even if it's a small step, a very, but that they have done something meaningful, and albeit, small, the dads, are the dads having the opportunity to go and help lead the walking club or the basketball play sessions before school starts. I know that that's something that we employ at our shacks. And I think that it was really good as a part of this summit to have had that point come out a couple of different ways and with a couple of different groups. Also making that point that everybody, people who are in this realm want to know that they have something specific and targeted that they can do at whatever level they're at within their student health.
It's always a struggle. I see steps being taken, like we used to have translators for people who were deaf as well as people who spoke Spanish, because we had a high Spanish population. And then leadership changes and all of a sudden those things disappear. And it's always a challenge to make sure that things stay in place. And that's why, I think Pete and I both emphasize policy so much. There needs to be policies in place that support encouraging all families to be able to participate regardless of, their levels. And one of the things that we learned too is a lot of our Hispanic parents were not comfortable because they didn't feel like they had a place questioning authority. And so you have to give them that permission, and you have to give them those opportunities and make sure they're aware, or they're a lot of times they're afraid because they're not here legally. So there's so many different challenges in trying to find solutions to make sure that we get those voices and we make them heard and we make it a safe place for them to participate, is something we just have to continue to focus on. So thank you for bringing that out, Gabrielle. Anybody else have comments? We are coming down to our last 7 minutes. I've had a few things entered into chat. Lillian's comment about they have some challenges with their non-English speaking parents. So they have been learning a lot and expanding their ESL program, which is awesome. And then thanks, Karen. It's good to know that PTA is working on that. Any other voices that would like to be heard? Or are you all just overwhelmed?
In a good way.
Well, yeah. Okay, good. Well, I don't mind giving you back 6 minutes of your day. I've dropped the evaluation information into the chat a couple of times. That will go out also with our recap, which probably will be Friday or Monday before I can get that out. Thank you all for coming and participating. Thank you to this wonderful group of moderators and leaders who helped bring all these sessions together. And we hope that you're leaving with ideas that you can use, new things you can try, and resources, and know that all of us are always going to be available. If you have questions, you can reach out to any of us. We'll make sure that you have contact information for all of us. And we're here to help support your work and help you make your schools and your districts healthy learning environments where everyone is successful. So yes, thank you to all the presenters and all the attendees. Thank you, Karen. Have a wonderful rest of your day. And we'll keep you posted. I'm sure we'll be having some webinars and things coming up after the first of the year. So we'll keep you going, and consider joining the Shack network. I think that's a good place to to gather additional information as well.
Thank you, everyone. And thank you, Michelle, for your leadership. We we are truly blessed to have your leadership from Action for Healthy Kids. And I love the last 20 years working with you is amazing. So thank you.
All right.
Thank you all for attending.
Y'all have a great day. Appreciate
Thank you. Bye.
Bye.
Bye-bye.
Let's see. You want to jump back on, jump off, jump back on? Let's do that.